August 2021 school committee meeting. I am really amazed so many people turned out to talk about the new strategic plan tonight. So here's what, first of all, before I do anything else, let's do the Pledge of Allegiance. Excuse me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you all. The Danvers Public School mission statement. The Danvers Public Schools is a dynamic community of independent learners dedicated to respect, responsibility, creativity, and the pursuit of academic and personal excellence. The meeting is being broadcast on Danvers Community Access Television. Is anyone else in the audience recording the proceedings? All right, I don't see any hands up. All right, so before we get to items of interest, so let's talk about how tonight will likely go. The COVID workshop follows our items of interest. Normally, during the course of items of interest, we ask for items from the superintendent, the school committee, and the community. And I just wanted to say that if you are here to talk about the masking discussion or participate in the masking discussion, please hold that. You don't have to come up. If you are, can you hear me now? Okay. If you are planning to participate in the discussion regarding masking, don't come up during the items of interest portion. We'll reserve that just for people who might have come here, believe it or not, to talk about something else. Once we have gone through the presentations from the superintendent, Board of Health, et cetera, on the COVID workshop, then we will take comments. I'm asking anyone who would like to speak to sign up on the sign-up sheet, which is, I believe, still on the table over there. So please feel free to go up during the meeting, sign up. We're going to observe our normal rules of procedure, which is that you get 3 minutes, but I don't intend to be crazy about it unless someone, really takes far too long. I'll get to it. In fact, I think we'll be able to hear from anybody who wants to speak. If you came not intending to speak, and at the end you decide you'd like to, then I'll just ask for anyone who wants to speak to raise your hands. We're going to try and get as much public comment as possible. So with that, let's begin our meeting with items of interest from the superintendent.
Thank you. This evening we have one item, and that is our scholarship thank you notes, and we want to thank the many seniors who reached out to show their appreciation for the scholarships that they received in June, and we wish each of our seniors success in their next endeavor.
Thank you. Any items of interest from the school committee? Nope.
Nope.
Okay. I do have a couple of items. One, since the last time we met, we have lost 2 former teachers in the system. Patricia Chisholm, who was here, both actually were here when Arthur and I were here, and was a yearbook advisor for many years and a member of the National Guard, and just a wonderful all-around person. The same can be said for Judith Yehudik, who was a social studies / history teacher when we were here also. And so we acknowledge their passing and wish the best for their family in their time of mourning. The other item I have is just really follow-up to a discussion that Keith and I attended not so long ago. I think it was maybe a month or 2 ago, sometime in July, with the town manager. And it has to do with the funding in terms of what Danvers pays for the vocational school. And one of the issues that comes up is that lately, the last couple of budget years, the assessment on a yearly basis for the town for the technical vocational school varies enough so that it's very difficult from a budget standpoint to be able to have consistency from year to year and plan for that. So I know that Town Manager Bother is going to be, if he hasn't already, authoring a letter to the vocational school to talk about that. And I think it's also on the radar of our state representative and senator. We, of course, appreciate everything that the vocational school does and the opportunities it provides for many students. But it's important that we have some consistency in terms of budgeting so that we are able to plan on a yearly basis for what the assessment might be. So there will be more to come on that. I expect we'll have more discussions in the future. Keith, did I miss anything that you'd like to add?
Nope, that was a good summary of our meeting.
Okay, thank you. Okay, so with that, let's move on to our COVID workshop. Superintendent Dana?
Thank you. We're going to begin with Mr. Taverner giving us an overview as we did all of last year.
So as we did throughout the school year last year, we'll quickly run through the cases that we've had each week since school got out for the town of Danvers. So if we start the week of June 18th, the town saw 0 cases with a 0.94% positivity rate over the previous 2 weeks. If we go on to the week of the 25th, again, that week there was 0 cases in the town of Danvers with a 69% vaccination rate of the townwide residents. And when we talk about the vaccination rates, we're talking about partially or fully vaccinated over that course of time. So if we go to the week of 7/2, there was 1 case across Danvers that was in somebody that was over the age of 60. We also break it down into different age brackets per the state reporting so that we can help analyze the data as it applies to students in the schools. At that point, there was 70% of the Danvers residents fully or partially vaccinated. As we came to the week of 7/16 is the reporting date. This covered 2 calendar weeks of time with the 4th of July. There was a reporting break that was incorporated in that time period. So there was 12 cases, 71% of Danvers was vaccinated, 0.46% positivity rate over the 2 weeks, and 42% of those cases were in children under the age of 18. So if we go on to the week of 7/23, you'll see that we had 5 cases. For a short while case numbers were down, we were able to report out the number of breakthrough cases that occurred. As we get into later weeks, you'll see that that data is not available. That is a request I know from multiple public health departments to the state, is to ask them to start to report that on a weekly basis, community by community, because it's important data as we continue our discussions. But in that week, there was 5 total cases, 3 were breakthrough, 71% vaccination, 0.46% positivity rate, and 20% of the cases were under the age of 18. The next week, the week of July 30th, there was 6 cases, 3 of them were breakthrough, a 0.65% positivity rate, and no cases in children under the age of 18. The week of 8/6, there was 28 cases. Again, this is where the breakthrough cases are no longer available, that data. There was a 71% of Danvers is vaccinated, so that number has become somewhat steady. Hopefully we continue to see that increase, a 0.65% positivity rate, and sorry, I misaligned my numbers, a 1.57% positivity rate, and with 25% of the cases under the age of 18. The week of 8/13, we saw the cases go up to 41 total cases townwide. The vaccination rate stayed at 70, or went up to 72%, a 2.67 positivity rate, and 39% of the cases under the age of 18 were 16 children. And then the week of 8/20, which is the most recent data, 50 cases, 72% vaccination rate, a 3.85% positivity rate, and 24% of the cases are 12 students under the age of 18. So Danvers has seen a similar trend to much of the state, with case counts rising over the past month or so. Now we wanted to go through a breakdown of the vaccination rates. So as of 8/19, there was 72% of residents, as we discussed, 64% with all doses and 8% 1 dose away. You can then see on the screen the vaccination rates in different age brackets. Obviously, the one that we're here to talk about is the 12 to 15-year-olds, which was 39% all doses and 11% one dose away. And then the 16 to 22-year-olds, which would include many of our high school students, 55% all doses and 9% one dose away. At the bottom of the screen, you'll see the pediatric vaccination rate. So this is something that has been shared with us through the Superintendent's Association so that we can do a comparison of our vaccination rate compared to the state. So the state is at 63% for 12 to 15-year-olds. Danvers is currently at 50%. And then ages 16 to 19, which is a little bit of a different breakdown, but 67% compared to 64% in Danvers. Now we wanted to walk through the different recommendations in a chronological time order that has come out over the past month or so. So on 7/18, the American Academy of Pediatrics released their recommendation that all students and staff should wear masks. On 7/27, the Center for Disease Control and Prevention, the CDC, released a similar recommendation that all students and staff should wear masks. On 7/30, the Mass Department of Public Health, in conjunction with the Department of Elementary and Secondary Education, released their recommendation for the school year. At that point, it was strongly recommending masks for all students in grade K to 6 while inside, strongly recommending that all staff, students, and visitors who were unvaccinated continue to wear masks, and recommending that students and staff who are vaccinated be allowed to remain unmasked. On 8/12, the town of Danvers released their local guidance for town hall and other non-school buildings that are under the town's control, and that was effective of Monday, August 16th. Employees and visitors were required to wear masks inside at all times despite your vaccination status. Additional guidance from DPH, this was a continuation of the slide before, but more detailed information. Again, that unvaccinated students are strongly recommended to wear their masks while inside buildings with the exception of eating, that no masks are required for any student while outdoors, at recess, at class, eating lunch, whatever that activity may be. Masks are required at all times in nurses' offices and on the school bus. That is something that has not changed since their original recommendation. Strongly recommending that all students 12 plus get vaccinated, and that individuals at higher risk of severe disease or living with a household member that share those similar risks continue to wear masks regardless of their vaccination status, which again aligns with the statewide guidance that was released over the summer. On 8/20, so just last week, the state released additional guidance. They have now moved towards mandatory masking for all students. They did release the guidance as K through 12. We do think it's important that as we discuss these guidances, because we are a pre-K to 12 district, that those same rules would apply for all of our students. So we did just tweak this to be pre-K to 12. In place from the vote, which the Board of Elementary and Secondary Education is meeting tomorrow morning at 10 a.m. at the state level, and if the vote is to pass, and if the commissioner is given that authority, that it would stay in place until October 1st. At that time, exemptions would be granted for communities whose vaccination rates are at 80% or above on an individual school level, so looking at it school by school. At that point, if you were granted an exemption, vaccinated individuals could remove their masks. Unvaccinated individuals would still be required to wear their masks. The commissioner is looking for the power to make this decision based on the exigent circumstances that he sees with the rising COVID statistics. So that's the kind of the caveat under the law that would give the commissioner the power to put in this mandate. And again, that vote would take place tomorrow, the 24th of August. So then if we go to how this means, what this means to the town of Danvers as we sit here tonight, masks, if it passes tomorrow, will be required for students till October 1st for all staff and students at the very least. The mask policy, further discussion and vote. We're here tonight to have the school committee talk about that topic and when that decision takes place for any Danvers local decision. Continuation of symptomatic testing in schools. That is something that we put into place last year, mid-spring, where we were testing Symptomatic students, we do ask parents to keep their students at home if sick, but if a student was to come down with symptoms while in school, the nurses had the ability to conduct testing on those students via a rapid test instead of going off-site. We are looking at the introduction of a test-out program for close contacts. So this is a new initiative being put out by DESE that we think is important to the educational outcome for students. So if a student is deemed a close contact in school, we'll have the ability to test that student for 5 straight school days in school. And as long as that student remains negative, the student can stay in school for the duration of the time and does not need to quarantine. If the student tests positive, then they would need to enter into quarantine per the state protocols. At this time, per the DESE regulations, students and staff who are vaccinated do not need to quarantine or test. If more data comes out on that, we'll continue to look at the state guidance. We will be looking at some sort of voluntary collection of vaccination cards to help be able to put into place the contact tracing. So that's important information that we'll need to know solely for that purpose of contact tracing, and which students or which staff members need to quarantine or not. The testing will continue through the Buy Next Now rapid testing program. So it's a test that comes back immediately while the student stays in school. If a student is part of this testing protocol, and while the test is being administered as if they're in the health office, right, following that protocols, they will have to be wearing a mask during that time. We continue to look at the state guidance around distancing. For this year, the state has said that no distancing is required for any students or staff. We do believe that having students work collaboratively in groups is an important part of their educational outcomes. So we will be looking at where we can help students get to work together in pods, especially with the test and stay protocols, to allow them to kind of get the most effective educational and social outcomes while also looking to protect students. And again, masks being required while on the bus and in the school nursing offices. So then, Mr. Chairman, I believe that's the end of our presentation. I know we have the Board of Health, the day from the Board of Health here tonight, as well as our 3 union presidents and a secretary down the way, Tracy. So we would like an opportunity for each of them to get to share what their thoughts are, maybe to kick us off.
Absolutely,
around
sure.
masking.
So first, I would introduce our new, relatively new, Director of Public Health. Dave, do you want to introduce yourself to the town and give us your thoughts on what is going on in terms of the COVID issue, statewide, in town here, and just in general, and we'll also allow the school committee to ask a few questions if you're okay with that. Thanks.
Good evening, members of the board and the general public. My name is Ade Solari, Health Director for the town of Danvers. I'm here to provide some updates regarding the current state of COVID-19 within our Danvers community. Let me start by
Microphone a little bit closer.
Let me start by talking about what we already know. We know that children under the age of 12 are not
We
eligible.
still need that a little closer, I'm sorry, Dave. Oh, is it on? Okay.
I think I'll just start over. Good evening, members of the board and the general public. My name is Ade Solari, Health Director for the town of Danvers. I'm here to provide some updates regarding the current state of COVID-19 within our Danvers community. Let me start by talking about what we already know. We know that children under the age of 12 are not eligible to get vaccinated.
Slide over this one that's wired.
We know that children under the age of 12 are not eligible to get vaccinated. We know that cases are starting to rise. We went from 0 cases middle of June to 50 cases last week. In total, we've had 119 cases in the last 3 weeks. 23 out of those cases are in the 0 to 11 age range. We know that the CDC considers Essex County an area of high level of community transmission, with the Delta variant being the predominant strain. The CDC now recommends that even fully vaccinated persons wear masks or face coverings when indoors if other risk factors are present. We know that the Delta variant is highly contagious, more than twice as contagious as previous variants, and may cause more than twice as many infections. We know that patients infected with the Delta variant are more likely to be hospitalized than patients infected with previous strains. Due to the exponential nature at which the virus spreads, coupled with increased indoor activities, as well as low humidity, cold and dry weather conditions in the fall and winter, we expect to see cases continue to rise. The good news is that we are not defenseless. We have highly safe and effective vaccines and personal protective equipment that can help slow the trajectory of this viral transmission. With the state largely leaving each community on its own to make town by town and district by district decisions, we have seen a few towns, districts, and cities step up to protect their residents and their vulnerable populations. Just to put things in perspective, we have 20 communities within the Commonwealth, Danvers included, that have implemented mask mandates within their municipal buildings. Communities like Belmont, Nantucket, Northampton, Provincetown, Salem, Truro, Wellfleet have all gone even further to require masks or face coverings in all indoor spaces. Salem and Worcester school boards have unanimously approved an indoor mask mandate for all students and staff at the beginning of the new school year, regardless of vaccination status. With the vaccine data showing an increase in vaccination rates within Essex County and surrounding counties, particularly among the 12+ age range, it is a reasonable request for the Education Commissioner, Riley, to ask the Board of Education to grant him authority to mandate masks indoors temporarily till October 1st. This will apply to all K through 12 public school students 5 and up, their educators and staff through October 1st, and will provide more time for students and educators to get vaccinated. If the masks can serve as a safety precaution temporarily till vaccination rates increase, I don't see any downside to that. This concludes my update, and I'm happy to come back with a more robust presentation if needed. And I want you all to remember that we are one variant away from rendering our current vaccines useless. The goal remains to get as many people as possible vaccinated. Thank you.
Thank you. Questions from the school committee? Jeff?
Thank you for that. Just a couple of quick questions. Can you confirm, can everybody hear me? I can move this closer. Can you confirm what the percentage effectiveness is against infection for the current vaccines? Because I've read in the latest CDC study, I read somewhere it was 55% against infection, 80% against symptomatic infection, 90% against hospitalization. Is that correct, or are those numbers not right?
Through the chair, those numbers seem accurate.
Okay. And so the rationale for masks then is we've been vaccinated, for those who have been vaccinated, the concern is 40-some-odd% of folks who are still vaccinated could be carrying coronavirus and transmit it to others. Is that is the concern?
Through the chair, correct. Mostly to unvaccinated individuals.
Okay. And in particular, the Delta variant, because of its transmissibility, has that in particular. Therefore, the recommendation for masks is not necessarily to protect people who are wearing masks. It's to protect the spread of the virus by people who might be carrying the virus to others in an airborne environment. Is that correct?
Through the chair, that's correct. At the same time, we want to make sure that we have more people vaccinated. And we also have breakthrough cases, but the breakthrough cases that we're seeing right now in Danvers, we only have 118, which is 0.23%. And that tells us that the vaccines are they're highly effective and safe. But correct, we want to make sure that we reduce the spread of the virus among people that are unvaccinated, as well as reduce the amount of breakthrough cases that may occur.
Okay, good. Because those percentages, the 20% of the symptomatic infection, the 90%, the 10% against for hospitalization would be considered breakthrough cases, right? Because if you're vaccinated and you have that, those are the current, if I read that correctly, the current breakthrough percentages. So I just want to make sure I understand the rationale for the masking requirement. I can't comment on whether or not this is going to, quote unquote, buy us enough time to get more people vaccinated. I'm not so sure there's going to be enough time to ever do that, honestly. So, I just want to make sure we understand why this is being done. Again, it's not to protect people who have masks, it's to prevent the spread of people who might have this. So those are the key questions that I had. The other question is, do we know what some of our regional hospitals' current ICU or capacity is right now? Because we've been reading stories about several hospitals having a significant uptick of COVID-19 patients. Is that the case in our area in Salem or Beverly as well?
Through the chair, I don't have that information at the moment, but I can provide some data regarding vaccination rates among the 12+ age range. And just to your point, we have, this is data from August 19th. In Essex County, the cumulative percentage of individuals with at least one dose administered is 69%. Cumulative percentage of eligible individuals 12+ with at least one dose is 79%. And cumulative percentage of eligible individuals 12+ who are fully vaccinated within Essex County is 72%. So we're seeing that age range, we're seeing the vaccination rate go up. And to me, the October 1st deadline makes sense because we're in August at the moment. Between now and October 1st, we can get more individuals vaccinated.
Okay, those are my questions. Thank you, Mr. Chairman.
Thank you, Jeff. Robin?
Hi. So just a couple questions. So you had presented the vaccination rates of the different age groups. That just covers though Danvers. So we don't know like the 12 to 15-year-olds and then 16 to 22-year-olds. We're not sure if they're Danvers Public School students. It's just they live in Danvers, correct?
Correct.
Okay. And then I know you mentioned the CDC. Other than the CDC and American and the AAP, what other medical professionals did your office consult with to say that you think that we all should be en masse regardless of vaccination until we reach the 80%?
Okay. Through the chair, I just want to make a quick comment on the first question you asked. I have the information regarding the vaccination rate in Massachusetts, and you were asking about the 12 to 15 age range. Is that accurate? So at this point, we're at 65% vaccination rate within the 12 to 15 age range, and 68% within the 16 to 19 age range.
Which is what we're
So-
saying, we're seeing slightly lower rates in Danvers specifically.
Right, because we haven't like collected that data yet to know specifically within the Danvers Public Schools.
We don't know specifically,
Right,
right, for the
okay.
Danvers Public
Okay,
Schools,
that's
but
what I
we
wanted to
are-
clarify.
The State Superintendent's Association has been sending out weekly or bi-weekly emails with vaccination rates, and Danvers is currently below those state averages for
Okay.
students 12 to 15 and 16 to 19.
And because it's all
Danvers, the town of
volunteer
Danvers.
too, it's voluntary, so again, a parent doesn't
Right.
have to share that, okay, all
Yep.
right.
Well, that data is collected through CVS or through the different vaccination
Okay.
sites. So that information is directly from the state databases. And a day can probably speak clearer to this, but every time somebody is vaccinated, it goes into a statewide database that tracks it across all medical professionals, so including our school nurses to have access to it. So that information is directly from the state.
So do we have a direct number for Danvers Public School students?
We do not have it for Danvers Public
Okay.
Schools, only residents of the town of Danvers in
Okay.
those age brackets.
Okay. And we don't have teachers either? We don't know how many
We
teachers?
do not know the exact percentage of teachers. We can tell you that when we did a survey last May, I believe that we were in the high 90% of individuals who responded, which was 300 plus, that were able to either be fully vaccinated or have an appointment for their vaccination. So we had probably, close to 3/4 of our employees respond, and over 90% of them were vaccinated or on their way to be vaccinated at that point.
But we didn't hear from at least 150 to know if they did or didn't. And when we say all staff, is that relating to just teachers? Is that custodians? Is that administrative assistants? Who are all the staff that we
I would
serve?
say teacher aides, teachers, administrative assistants, and our cafeteria workers, as well as central office and district support.
Okay, all right.
So,
Okay, so then I guess I'll repeat the last question I had is like, what other medical professionals did the Board of Health for Danvers consult, other than, the CDC and American Association of Pediatrics?
Through the chair, we usually get data from the MDPH, the NIH, MAVEN, and CDC.
Okay, thank you.
Alice?
Thank you. I'm going to focus most of my questions on the children, that age group 0 to 18. Did you find any link between the children that tested positive? Did they partake in any of the Danvers camps, summer schooling, or tutoring?
Through the chair, I do not have that information at the moment.
Okay.
I can answer specifically for the Danvers Public School summer programming that we did not have any cases over the course of this summer.
Great. And confirming, though, that the kids did not wear masks this summer, nor did the teachers, correct?
Masks were strongly recommended for students who were unvaccinated, but it was left up to the parental decision.
Okay, thank you. Can you comment, all right, as a parent, unfortunately, I made the decision to purchase masks for my children just to be prepared for the school year. We all purchased masks. There's warnings on those masks that says that it does not prevent transmissible diseases. Can you comment on that you're requesting us to put masks on our children when there's a warning that says that that's not going to protect them?
Through the chair, there are many peer-reviewed articles that shows that masks work. I am able to provide some of those to you. I don't have that information at the moment, but I can email them to you or send them to you directly.
I'm going to finish not with a question, but more with a statement. I'm really nervous about what you're saying about the vaccines, because my biggest fear is that this is going to turn into a vaccine mandate. And I'm saying this now, that I will not support a vaccine mandate for our children. And honestly, look, I don't want this to be a political issue by any stretch. This is not, like, I hate this conflict, But this is what I'm hearing, and it's scaring me. That's it.
Thank you. Arthur?
Just a couple of questions. Ade, or Keith, I don't know if you guys know this, but you showed the charts with the number of cases, but to me, the number of cases are not really as relevant as it used to be. To me, I'm looking at hospitalizations. Do we know what percentage of those cases that we have shown in Danvers have resulted in hospitalizations?
I don't believe that data's released by the state on a community level. I've spent some time in those weekly reports, and I don't believe that I've seen that. I know through just our on-the-ground knowledge, working with public health and with Judith Ryan in the day's office, who is great, that we've only had one case of a vaccinated breakthrough that was a hospitalization, but I couldn't tell you the overall hospitalization rate of that. I mean, that's some data that we could attempt to try to collect, but not something that we have available for tonight.
Yeah, I've spent time in all those databases too, and I don't see it, but I was hoping, or maybe just at least wondering if the town, when they have their cases, determine how many of those people actually are hospitalized.
Right, and typically contact tracing happens earlier than the hospitalization would happen. So our contact tracers, and through a day's office and through the state contact tracers, really takes place at the onset of contracting the infection. And then after that, we rely on the data that's reported back out from the state. But that's certainly something that we could inquire with the state if that information's available in another format, or ask them to make that information available going forward and see what they say to that request.
Well, it's important because what we have is changing over time. It's not the same as it was 18, 17 months ago, whenever it started. And, and the cases sometimes go, like, for example, my son's, where he's going to school right now, everybody has to be vaccinated to go to the school. Every teacher has to be, every professor, at the college. And they had, he told me his classes started in July, so he told me that there've been about 100 cases down there. It's a big school in North Carolina. But none of them were sick. None of them. I mean, they're all vaccinated people, and none of them were sick. So that's why it's important to know what is the extent of these cases. It's not just cases. And that can be seen by the fact that obviously the number of hospitalizations, I think right now we're at around 500 in the state, substantially down from where we were previously. And so that's important. Deaths are down, way down also. The other question I have is about the breakthrough cases. And again, Ade, if you have the information, it seems like what I was reading is that, and you may have more up-to-date information, this is probably from a couple of days ago, we have about 12 or 13,000 breakthrough cases in Massachusetts. Is that about right?
Through the chair, as of last week, it was 9,000.
Okay, so maybe I read something more recent. And we have 4.5 million people that are vaccinated, so it's like 1 in 40,000 or something like that. I mean, 1 in 300, 400, something like that. And hospitalization-wise, there's something like 400 breakthrough hospitalizations, or 450, which is, again, 1 in 9 or 10,000. So obviously the vaccine does work, but what it's also telling us is that if you have the vaccine, your chances of getting the virus are pretty slim. And if you get it, the chances of it being a problem are extremely small. So is that what we're seeing?
Through the chair, yes.
Okay.
And
All right,
pretty
that's
much
fine.
what the vaccine does is it doesn't 100% prevent you from getting COVID. What it does is it trains your body, and gets your body ready just in case you get infected.
And it minimizes the effect, correct?
Correct.
Thank you. I don't have anything else.
Thank you, Mr. Scarmus. Just a couple of questions. And in terms of the variant that we're dealing with now, is it fair to say that the variant is more easily spread than previous variants of the COVID?
Through the chair, the Delta variant is highly contagious. It's more than twice as contagious as previous variants, and it may cause more than twice as many infections.
And one of the issues with, and correct me if I'm wrong, but while the vaccines work very well in terms of if someone does get infected, they're not going to get as sick, they can still spread the variant pretty easily. Is that correct?
Yes.
Okay. The last really is a comment rather than a question, which has to do with the vaccine mandates. To Alice's point, I don't know that individual communities are going to be given the choice of whether or not to mandate vaccines. I would guess that just like, you know, the vaccines that students have to have now before they go to school, it's going to come from the Department of Public Health. So I certainly wouldn't anticipate that individual towns will have to make those decisions. Oh, one more question. Ade, you mentioned that, I think you said we're one variant away from the vaccines not being effective. Can you talk to that a little bit, speak to that a bit?
Through the chair, so the way it works is with the virus continuing to spread among the unvaccinated individuals, there's a high chance that new variants might evolve. And once they do, we might get a variant that the vaccines don't protect us against. And once we get that, that will be the end of the vaccines.
So then we're kind of back to square one.
Pretty much, we're starting all over.
Okay. That's all I have. Let's turn it over to Kathleen. Do you want to talk from the standpoint of the teachers and staff?
Thank you. So as the representative of the Danvers Teachers Association, president of the association, I was invited, as was Tracy, the secretary of the Teachers Association, and ultimately the question of masking is particularly as a mandate, is something that really falls in the purview of public health, and is a policy that, you know, this committee is going to have to decide, perhaps, if you choose to, given what is likely to happen at the state level tomorrow. It doesn't seem quite as necessary, perhaps, but nonetheless, it is something that really needs to be an informed decision based on public health guidance. And as we've heard, the American Academy of Pediatrics and the CDC and other public health organizations have suggested that masking as a mandate for indoors, including inside schools, is the sort of safest way to prevent the spread of COVID. And especially knowing that a lot of our students, K through 12, but especially K through 6, are unvaccinated, there is that sort of wisdom coming from the public health folks that masking is an excellent idea, is necessary. However, the DTA, the Danvers Teachers Association, did in fact poll our teachers, and like society at large, there's not a unified voice. We had more than half of teachers suggesting that they were in favor of a mask mandate, but it was not everyone. So I'm not in a position to say that I believe, as a representative of over 300 teachers in the district, that the school committee should vote in a particular manner. I can tell you that every teacher I know will be wearing a mask as we start the school year. It's something that teachers definitely believe in as a concept to keep people safe and healthy. The question is really about whether or not it should be mandated. And on that, the teachers are honestly somewhat split. So I can say that the teachers of elementary school children are more in favor of the mandate because their kids in particular are definitely unvaccinated. Ultimately, you know, this is a public policy decision. I hope that you base your decision, if you choose to make one tonight, on science and what we know of this very, very tricky disease that we've all had to deal with for far too long now. And just keeping in mind the unvaccinated population and the fact that this particular variant is far more contagious than what we had to deal with last year. I'm proud of the fact that we as teachers and the rest of the community in schools were able to keep transmission rates down very low last year. But we all wore masks all year in doing that. So, you know, ultimately, we don't have a unified voice as teachers on this one. We had about 60% that thought the mandate was a good idea. So I have to just kind of leave it at that. And, you know, I appreciate the thought and the facts that are going into thinking about how you want to approach this.
Thank you, Kathleen. Let's see, Kathleen Spinella.
Hi, on behalf, I'm the unit steward for the administrative assistants. The unit administrative assistants for the Danvers Public Schools are as always ready and willing to perform their jobs to support our faculty, staff, and students and families. And we look forward and appreciate the opportunity to be part of the conversations moving forward as the situation evolves. As the teachers have said, it is a public health decision that this board will make, and it sounds like will be made at the state level. We will be here to do our jobs and support all of you, regardless of whether it's mandated or it's not. We'll be here.
Thank you. And Kathy Johnson.
Thank you. Like the teachers did, I polled all of the teacher aides on the question of wearing masks, coming back to school with masks or not. And similar results, I had 60% of aides who answered me felt that we should begin the school year masked, that the information available to us now, as well as our experience from last year wearing masks all year long, it made sense that we at least begin the school year being masked. One aide remarked to me that we are in the business of protecting children, and we felt that that was one way that we could protect, particularly through K-5. I do work in an elementary school, but particularly to be able to protect those children who are not vaccinated and who, at this point, cannot be vaccinated.
Okay, thank you. Appreciate your input from everybody. Anything else from the school committee before we open it up to the public?
I want to thank you guys for your full transparency, because you could have easily sat up here and said that a majority of teachers want masks, but you didn't. So I thank you for being fully transparent with us on that. Thank you.
Anyone else?
I
Robert?
think this is more of a question for central office. But let's say that, you know, we vote no on masks and someone gets sick. And I mean sick with COVID, can a parent sue the school for failure to protect their child because it's a public health crisis?
Wow.
No? Okay.
Right, I would say that, again, we would consult with our town council and our school attorney, but we don't have that exact information for this evening.
Can't hear you.
We would go back and consult with our school attorney and with our, the town council as needed.
Okay, so I guess, a little bit, just some concerns I have is we have some information, but we don't have all, I feel like the information that we could have. Like I think it's our duty to know that if we're, as a parent, I would wanna know, like if I'm sending my kid and they get sick because the school didn't protect them, what's the legal parameters here? I think that's something we should have had ahead of time. Also, I feel like we still don't have the facts as far as like with the teachers, like we don't know again, like who's been, vaccinated, and we haven't, yes, like there was a survey done in April, and that was great, but where is like the most recent update, So, and again, it was over 150 people who did not want to share that information for whatever reason. So, again, we don't, Aday, like, thank you so much for your information. I'm concerned, though, that we don't have a medical professional right here sitting today, from an unbiased point saying this is what the science says. So, again, I feel like we have a lot of things that are unanswered, and that, to me, is a problem. That's just my thoughts.
Thank you, Robin. Anybody else? No? Lisa, one of the questions I think that is likely on people's minds is that if in fact the state or we were to mandate masks, we know that there are going to be students who may have issues, who will have difficulty wearing the masks all day, that sort of. So what can you talk about from a logistical standpoint, how we're going to go about supporting those students, whether it's special education students or students generally who, for one reason or another, will have difficulty with masks?
I would say from our experience last year, children in all of our schools were very cooperative, and we worked with all families and we worked with students in wearing their mask. And I think, again, at the state level, the state puts out an FAQ with a guidance, and then we also have our school council, which is also the attorney for the Massachusetts school superintendents, and they continue to work with DESE's attorneys also and take a look at any of the legal questions that are coming up.
Okay, but in terms of what is raised sometimes are mental health issues, that it's too hard on students, that they suffer mentally from having to wear masks while they're going to school. Do we have any sense that that's an issue, and if so, what would we do about it?
We continue with our work with our social emotional learning and working with our students. So if they present with any distress, working through our principals, the teachers, we have social workers in all of our schools. We have our school nurses. So there are many adults that will work with students if they are having any difficulties with wearing a mask.
Okay, thank you. So at this point, we can open it up to public comment. And do we have the list, Diane? We do. Thank you. All right, so what we'll do, we'll start with Suzanne Wright. And I'm going to ask you to go to the microphone behind the podium, Suzanne. And if I butcher someone's name, please forgive me.
Hi there. Fortunately, my name was not very butcherable, so we were okay. Thank you for taking the time to hear me. I've not ever spoken at a school committee meeting or even a town meeting before, so please bear with me. Public speaking is not my jam. I'm a nurse. I've been in health and medicine for the last 26 years and have been on the front lines of this pandemic for the last 2 years. I have faced this virus every single day. I know what it is, I know what it can do, and I frankly find it appalling that we're even discussing not sending our children back to school with masks. Our children ages 0 to 12 are not able to be vaccinated. The only thing that protects these children from getting COVID is a simple face mask. Politics aside, science is based in evidence. Every single society, the American Academy of Pediatrics, the CDC, I'm sorry, I'm so angry.
No, that's okay.
There isn't a single medical society of people that have degrees in science and medicine disagrees with the fact of putting people in masks to prevent the spread of this vaccine. I too wish we were not in this pandemic. I too wish I didn't have to make these decisions for my child. But these children don't get the option to get a vaccine or not get a vaccine. They can't get the vaccine. We need to protect them. This is a very simple, science-based decision. Degrees in advertising, degrees in law, whatever it is that you think you've drawn your information from, it's appalling to me that we have all of this scientific evidence out there and people are second-guessing it. Okay, sorry, let me go back. Sorry. My child is entering second grade at Smith School. He obviously has no option to receive a vaccine to protect him. It's imperative that we protect these children who have no other options. The answer is simply to continue this mask mandate in school. The virus is spread by droplets that emanate from the respiratory tract. A proven method to minimize this transmission of this deadly disease is by wearing a simple mask. Schools are places where people talk, laugh, sing, shout, sneeze, and cough. Wearing a mask protects the people that are most vulnerable. Personal choices are just that, personal. Once you make a decision that affects other people, it's a safety issue. If you would like to drink and sit in your car and be drunk behind the wheel of your car, that's fine. The second you put it in drive and affect the safety of others, then it becomes a problem. It's a safety issue. The school committee has an obligation to keep students safe. That's all students, regardless of vaccination status or political beliefs. I find it upsetting that you've chosen to make this a discussion about mandated vaccinations. That isn't what the discussion was supposed to be. It's about protecting kids who can't get vaccinated yet with a simple face mask. That's a completely other topic altogether. It's appalling to get people riled up about something that isn't even on the table and isn't even going to be in the purview of this committee to discuss. If the state mandates vaccinations, then that's what they're going to do. Okay, please do the right thing. Enact the mask mandate. It's just appalling that people are getting their information off Facebook and TikTok videos instead of actual science. If you need help reading scientific evidence and peer-reviewed research, I'm happy to help you with that, as I am sure our medical person is as well. Thanks so much.
Thank you. Next up, I believe it's John Gaeta or Gaida, and again, I'm sorry. Thank you.
Hello, everyone. Thank you for hearing me. My name is John Gaeta. I have a child entering Danvers High as a freshman who went through the Middlesex, Holton Richmond. I am 100% against getting a vaccine and a mask mandate or any form of a mask. I understand that people are concerned, but I'm concerned about my rights as a parent and as a person. We have a Constitution, we have a Declaration of Independence, and we have a Bill of Rights. I can decide what is best for my family, just like everyone else here has a right to decide what happens to their family. We know that masks don't work. It's a piece of cloth. COVID virus is a microorganism. It just transferred on a water droplet. So you're gonna get it. Just like we get the flu every year, and we get a vaccine, and the flu doesn't work, the shot doesn't work. I've gotten the flu after having the vaccine. We're gonna get COVID, and we're gonna have to live with it. Doesn't matter how many people get COVID. It matters how many people are in the hospital, are on a ventilator, and how many people die. We all live with the flu, we all live with TB, we're gonna have to live with COVID. So the time has come to put down our feet and say, it's our choice to decide what happens to us. An N95 mask, as everyone here knows, is only 95% effective. That is why it is an N95. So if that's only 95% effective, what does a cloth across your face do? What does a paper mask do that's made in China? I don't want my child breathing his own carbon monoxide for 8 hours, recycling his germs. Children don't get sick because they have a great immune system. And we have to decide that we decide what happens. I see people walking in here with their masks on, taking it off, talking, then once the camera goes on, that mask goes right back up. And I have pictures of that. So that shows the hypocrisy that people have here. It's only good when it's a talking point and when it's a narrative that will fit what they want to push. The CDC, the teachers, all the medical professionals, all they're doing is pushing what they feel is safe so they don't get in trouble. You're not going to get COVID and make someone sick and get sued. Just like over the years, people have gotten TB, the flu, they've never got sued. So let's not worry about that. It's not a money issue. The issue is we have a right to decide what we do to ourselves. I worry about other people, yes, but I worry about my children, my flesh and blood, and what's best for them. That's what we have to decide. Leave it up to the people to decide. Just like we decided to vote for you, so you can hear us and do what we ask. You're an elected official, you're an employee, we are the employer. We voted you in, so you can do what we want. Just like if you don't, we vote you out. So what I ask is that you sit down and you say, what is best for me? What is best for the people that come up here and want their rights to be heard? I was in law enforcement for 25 years. I've seen everything you could possibly imagine. And it all comes down to what is right for that person. If you want to wear a mask, fine. If you don't, that should be your option too. Just like if you want to have if you want to get a shot, and I do not believe in gene therapies. That's a shot that actually changes your genes. It's setting your body up to fight something in a DNA setting. They tried that with cancer, it didn't work. This is not just a dormant virus that they give you. It's a genotherapy. No idea how that geno is going to affect my child, my children, and their future children.
All right, you're at the 4-minute mark.
Okay, well,
Nope, we
thank you
appreciate
very
your
much.
comments. Huh?
I just wanted to get my point. And it comes down to a basic decision, leave it up to the people. That way, you're covered. Thank you very much.
Next up, Lisa Silva.
Hi, my name is Lisa Silva. Can you hear me? Can you hear me? Or is this? I'm a Danvers resident. Thank you guys for letting us. I have the Danvers school system. I have a middle schooler who's 12. He's been vaccinated. I have a 10-year-old. He's not eligible to be vaccinated. So in our house, we have somebody who's not protected. My older son and I have been wearing our masks since the number, because, like some other people said, my 10-year-old doesn't have a choice. If I could get him vaccinated, I would, but I can't. And I have to send him to school. And all the kids are going to be in school. A lot of the restrictions just aren't possible. A mask is his only defense. So I ask you to implement this mask mandate because you need to protect the entire student body. And with 12 to 15-year-olds, the vaccination rate in Danvers is 39%. Under 12, it's 0%. So imagine a state like that. What do their numbers look like right now? We are ultimately at the same place we were last year. And we wore masks last year, and we social distanced, and we got through it with pretty low numbers. But that was when we were doing everything we possibly could. And not all the kids were in school. A lot of them were home. My kids were home. So if we want to know what's going to happen if we don't wear masks in a mostly unvaccinated population, all we have to do is look at some other states that have very low vaccination rates. So I ask you to please, that can't get vaccinated, because we don't have a choice. Thank you.
Thank you, Lisa. And next, we'll hear from Todd Cormier.
Okay, thank you for hearing me here today. I'm not qualified to, talk. I'm not qualified to, talk about science. It's not really what I'm here for. Ultimately, what I wanted to try and get through today is I'm hoping that you wants to sign or once the statistics start shooting in another direction. At this point, but should that continue to rise, I can understand why people would want to, take into account whether or not we should wear masks. But at the end of the day, it seems somewhat moot right now where DESE is going to step in and perhaps mandate that. But one example would be what happens in October should they reverse that decision. Where does Danvers, and when are we going to know kind of what our thought process will be relative to transmission rates and where we need to be to take that mask mandate away. I just would like to know if we're going to be polling teachers, can we get those statistics released to us so we can see, of that 60% that said, what was the exact number? And is there going to be a survey that's released, later this year? And I just would ask that there's more transparency, because I think last year one of the things that some parents and I fought for was that we'd know a little bit more about what was going on behind the scenes, and I just didn't feel as though we got that. At the end of the day, again, there's going to be people that are far more qualified to talk about the science and where we should really be there, but I'm just asking that we don't let the discussion about transparency fall behind the wayside. I'd like to understand every single meeting where we are, relative to just understanding, last year, as an example, we knew exactly, what we need to do in order to close down and go full remote, right? But we never knew when were we going to go full back, in school. And it wasn't until DESE stepped in and said, we're taking control, everybody's going back, that Danvers said, okay, we're on board with that. So I wowould just like to know, for every statistic that we have that's going to take us out of school or require mask mandates or whatever the case is going to be, where does the reverse of that fall? Because, it just leaves parents frustrated, I think. So appreciate you guys listening to me. I'm sure it's not an easy job, but thank you.
Thank you. Oh, boy. Mark Minarsto?
No, I think we go down to this one.
I'm sorry, is it Matt Horgan? I say that only because it's crossed out. I swear to God, it's crossed out, Nick. I told you it would happen.
Yeah, that's all right. Happens to me. Again, I'm not a great public speaker either, so kind of bear with me when I go through this. I had a couple of bullet points to try to keep me on track, because I have a habit of going in a bunch of different directions when I talk.
Arthur's going to tell you when to stop.
I had ultimately, if we're talking about masking up because we're trying to get to a percentage of people that are vaccinated, or are we talking about trying to protect kids who can't get vaccinated? I think those are essentially kind of two different arguments. One, I think everyone here has had at least 7 months who are of age to get vaccinated. You've either made that choice as an adult to get vaccinated or not get vaccinated. So at some point, I do feel like the responsibility has to fall on that individual or those individuals, and not me and not my child. And if we're going with kids, who are unvaccinated and can't be vaccinated. Again, to someone's point before about the numbers of people coming down with COVID opposed to people or children that are getting hospitalized, and again, of children who are dying. Yes, we can sit here and say that any death is terrible, but correct me if I'm wrong, but I think the CDC put something out there. It's under 400 kids in the United States who have died with COVID, and I specifically say with and not from COVID, because we don't know, and as far as I've been able to research, we don't know whether or not it's been, it could be some child who is dying of cancer, but they tested positive with COVID. So again, they were very specific in that data that states that they died with and not from. So the numbers are, I just don't think it supports us being able to mask our children. But again, if you want your child to be masked, put a mask on them. If you want your kid to wear two, put two on them. Throw as many masks as you want on them to make them feel comfortable. Again, but I should be able to have the choice to choose whether or not I want to put that on my child. And I think we're also not thinking that there's not enough studies that are out yet. There are some kind of preliminary studies about it, but what are masks doing to our kids? Again, our kids are breathing recycled air. Like our kids, as they're growing, they need oxygen. We can't be sucking in this recycled air. It's not healthy. I think there's been studies about different viruses. Like these masks get really dirty and really nasty, and it's just sitting on their face. Also, it's teaching our kids. Like I don't want my kid walking around, or my children. I have two children. One is 9 and one is 11, both in those Danvers school systems. But I don't want them being in fear that the air around them is toxic and that they can't breathe something. And there's a point where again, is the negative outcome of wearing a mask going to outweigh the very, very low numbers of kids who are even being hospitalized? I get back on track. But again, so like even with the mask, so they're recycled air. They can be dirty and nasty. They're not learning social cues, basic social cues in school, where they're supposed to be learning either pronunciation from a teacher in an English class, or again, social cues of whether or not someone is trying to give them like a good vibe or a bad vibe. They're missing all of this, and it's sad that it's come to that. And I hear, this is again another side note, that that we're talking about it like it's a positive thing that the communities around here are stepping up and forcing these mandates. I mean, I would like to see more communities around here stepping up and not forcing them. Again, it's not do you, let me do me. That's all I got. Thanks, guys.
Thank you. This is easy. Mark Smith.
Well, good evening and thank you. I just have a quick point of parliamentary procedure. Are we allowed to ask questions, or does that cut into our time as well?
I would allow questions.
Okay. So a follow-up question to Robin Doherty's question. So if mask mandate is not put in effect and someone gets sick, can they sue? My question is, if we mandate vaccines and someone has a permanent disability, life-threatening illness, or dies, are you responsible? So with that said, I will start with my talk. I'm going to open up with a quote from Martin Luther King, Jr., and he said in 1967, "We must speak with all the humility that is appropriate to our limited vision, but we must speak." And you're from the public health Danvers. You didn't come with any peer-reviewed studies to demonstrate. We're talking about masks, so you didn't come prepared. You don't have hospitalization numbers. You don't have the infection fatality rate numbers, and you didn't bring any peer-reviewed studies. Well, I'm here to help you, because I did. So here's one from the British Medical Journal in 2020. It says, "Face masks and similar barriers to prevent respiratory illnesses, such as COVID-19, a rapid systemic review." I'm not going to read the whole thing, but I will quote from the article where it says, "Discussion. The evidence is not sufficiently strong to support widespread use of face masks as a protective measure against COVID-19. That's one. This is from the British Medical Journal, 2015, a cluster randomized trial of cloth masks compared with medical masks in healthcare workers. Again, I don't have time to read the whole thing, but I would encourage people to do some research on their own. So let's skip ahead to, here we go, the conclusion. This study is the first randomized control trial of cloth masks, and the results caution against the use of cloth masks. This is an important finding to inform occupational health and safety. Moisture retention, reuse of cloth masks, and poor filtration may result in increased risk of infection. Further research is needed to inform the widespread use of cloth masks globally. So that's another one. This is from the European Center of Disease Prevention, 2012. The use of masks and respirators to prevent transmission of influenza, a systemic review of the scientific evidence. And I quote, none of the studies established a conclusive relationship between mask respirator use and protection against influenza infection. This is from the National Institute of Health, 2009. Use of surgical face masks to reduce the incidence of the common cold among healthcare workers in Japan. A randomized control trial. And I say randomized control trial because that's different than an observational study, which is what the CDC and your public health department is using. A randomized control trial is much better. And the conclusion in this study is face masks use in healthcare workers has not been demonstrated to provide benefit in terms of cold symptoms or getting colds. A large study is needed to definitively establish non-inferiority of masking. This is from the British Medical Journal, May of 2021. Mask mandate and use efficacy in state-level COVID-19 containment. The results, I quote, case growth was not significantly different between mandate and non-mandate states at low or high transmission rates, and surges are equivocal. Conclusion, mask mandates and use are not associated with slower state-level COVID-19 spread during COVID-19 growth surges.
All right, you are at 4 minutes.
I appreciate the extra time. Thank you, Mr. President. The American Medical Association 2019 N95 respirators versus medical masks for preventing influenza. Well, this one I'll have to skip because I didn't.
4.5 minutes, we're going to stop you now.
Oh, here it is right here. Well, actually, the question was asked, and he didn't bring the peer-reviewed studies. I did, so I'm helping the conversation.
That's enough, sir. I'm going to ask you to end your presentation.
Let me just finish this and I'll wrap it up. Among outpatient healthcare personnel, N95 respirators versus medical masks, as worn by participants in this trial, resulted in no significant difference in the incidence of laboratory-confirmed influenza. So I have several others. To wrap it up without going into it, because I think 4 minutes is really not sufficient.
Now you're at 5 minutes.
It's not sufficient to get into the science of it. So the randomized controlled trials, and I only came to talk about masks, the randomized controlled trials done by several peer-reviewed organizations, published, peer-reviewed, all state definitively there is no statistical significant difference with masking. They don't stop. Thank you.
Okay, next up, Eric Hornstein.
Hi, thank you for the opportunity to speak. I sent along my thoughts and a whole bunch of supporting data that I'm sure you received and read, but tonight I just wanted to talk as a parent. I'm sure, like all of you, I sat glued to my TV since early on in this pandemic, literally in the beginning with a pen and paper, and listened to lots of what came to be conflicting data. First, masks were mocked as useless and silly to be worn by healthy individuals, and especially if they were anything other than an N95 mask. Later, facial coverings of essentially any kind excuse me, were forced, and leaving many of us to wonder, well, which is it? The difference now is that we have our own data. It was unprecedented before, but now we've been through this. And what we learned is that children love their mask, and they're perfectly comfortable and made to feel safe wearing it, and they seem to wear it seamlessly their 6-hour school day and beyond, and that is their experience. Other children were faced with anxiety and fear surrounding their masks, social cues, and this one broke my heart, but one of my kids' friends, I asked them how they liked school. Once they were back in school, he told me he hated it. His teacher seemed mad all the time. He was a quieter child who seemed to disappear behind his mask and come to life when his mask came off, and that was heartbreaking. Still, other children like mine had a tough time physically wearing them. One of my boys, it sparks this like cough, this little tickle. Also gave him headaches. There were days he missed school because of a mask and not because he was sick. He just couldn't do the mask for extended periods for an entire school day. We tried disposable masks. I packed extra so he could change them. We tried reusable and washed them nightly. Nothing worked. And I can assure you that him adjusting it constantly, yanking it down to breathe, it was not doing him or anyone else any good. All of these experiences are valid and should not be ignored. They are our data, right? So the bottom line is, in my opinion, masks should be the parent's choice. So that's how I feel about that. I think I also need to state, however, that while I don't support a mandatory mask policy, nor do I feel the data supports a mandatory mask policy, as I emailed, a school system that claims to value inclusion never ever should consider the possibility of segregating one population and forcing them to wear a mask and not all of the students. So needed to be clear about that as well. I'm also going to take the opportunity to speak to mandates in general. I want to be adamantly clear that I'm not anti-anything. That divisive rhetoric is just simply false. My hesitancy on behalf of my children when it comes to masking or to the COVID vaccine comes from a place of having knowledge about my own children and their background and their risks in conjunction with their medical professionals that no one else here could possibly have. And that's okay, because they're my children and my God-given responsibility. And I've passionately parented them since before they were even born, and will continue to make educated, conscious decisions on their behalf for as long as I live. That's not only my right, but my responsibility. Plus, during these times, I have many questions. Breakthrough cases are concerning, continued research regarding natural antibodies and reinfection is minimal, and this is also concerning. But I do want to say that I have the utmost respect for every parent here advocating for their kids, no matter where they stand on these issues or any others. This is tough. We're balancing the newness of it all with the here and now, as well as the long-term health of our kids, the ever-changing data and recommendations, and I'm confident that no matter where you stand, every parent here has lost the same amount of sleep I have trying to do what's best for my kids. But that is my job. That is our job, right? My final point here tonight is I hope that every one of our kids is home watching, because what they'll see here tonight is the most important thing they'll learn this entire school year from their parents and should be reinforced by the Danvers Public School system. Number one, ask questions. Do your homework. Respectfully agree to disagree. Respect others and their right to their opinion and choices. Advocate for yourself. And above all, never ever be bullied into making any decision that you and only you will deal with the consequences of. Thank you.
Thank you. Rebecca Franke?
Good evening, school committee. Thank you for the opportunity to speak today. For those who didn't do math in the audience during Mr. Taverna's presentation, cases in Danvers rose 700% between the weeks of the beginning of July to just last week. In addition, we talked a lot about the vaccination rates and people who are fully vaccinated versus one dose away. The town is only at a 64% vaccination rate in total, 39% for kids ages 12 through 15. Again, we don't have to remind anyone that cases continue to rise in Massachusetts, across the country, and throughout the globe. The CDC employs 1,700 scientists, and the American Academy of Pediatrics has almost 70,000 members of pediatricians. Those two groups of expert staff and clinicians recommend masking for school regardless of vaccination status. Let's not pretend to be more knowledgeable about virus transmission or virus severity than they are. As we've learned, optional masking is not effective at stopping transmission. The only way to ensure our kids are in school full-time this year is to have everyone wear masks. I'm grateful that I actually didn't have to deal with remote learning last year, as my oldest child is just entering kindergarten. Let there be no mistake. If cases continue to rise on the path that they are today, remote learning will be the only option that we have. Matt, I think it was you who the only 400 children who died of COVID in the United States, or had diagnosed with and then passed away with COVID. I don't think anybody in this room would want to know me if that was one of my children hearing a comment like that from you. I heard from Mr. Taverna as well that the state is doing this and the state is doing that, and tomorrow we might have a choice anyway, right? What I hear from that is Danvers does the minimum. We'll do what the state says, but we're not willing to take a stance and do what's right. The reality is the state may or may not mandate masking tomorrow. Let's not wait to see what happens. Instead, let's make a decision that works for us. It works for Danvers. School committee, we've put our trust in you to make the right decision, and I trust that you will. Thank you.
Thank you. Mark Zubrick.
Thank you, Eric.
Thank you, Mark.
Do I negotiate for time as well?
You'll...
I want at least 8 minutes. Well, the first, my name is Mark Zubarek, and I'm a former selectman, town meeting member, and all that stuff. The one word that I heard today, this evening, transparency. Transparency is a key word that we do not always experience in this town. Many thoughtful people have analyzed the issue, but they're not going to make that decision because the school committee has probably already deferred this decision till tomorrow when the state dictates whatever happens. But let me just go through my prepared notes, because I have not appeared before the school committee for a long time. And recently, the governor has removed himself from imposing all restrictive actions because the actions taken in the past were not legal and directly impacted our freedoms. The governor now wants to use local communities and boards to continue the state's illegal actions. Monumental changes do not always occur with fanfare and explosive action. Sometimes they take place gradually. And what we're seeing, gradually change is taking place. Our life is affected. It is a result of actions that initially appear relatively inconsequential, but develop into extraordinary alterations in the very fabric of our society. The school committee, and you're gonna shoot me, has abdicated their primary mission to educate our students. We are being trained to become isolated and fearful of large group gatherings and public meetings. And it's not necessarily your fault, it's our government fault, whether it's local or state. Our students have been cheated of 1.5 years of education in 2020 and 21. Remote learning has failed. Parents had to rely on tutors and homeschooling. Why did the school population decrease this year? How did we measure performance? There is no measurement of what happened during the last year. Masks are not medically required. The governor has not indicated that he is in support of masks for students. Our local health dictators are instructed by our local government to recommend these masks. The school committee must...
Mark, I'm sorry, but that's out of order.
That's what?
That's out of order to refer to local health officials as dictators. But
Well, fine, then
continue.
I'll change that.
Continue.
The school committee must not succumb to the controls requested and refuse the masks for health and welfare of our children. The school committee leaders need to refocus their attention to educating our students and not on controlling our school population. What are we afraid of? The China virus or the retaliation of the health department and teachers' unions? The parents must take back their rights and resume the role of bringing up their children. And I will correct one of the statements here, because what I heard just this evening is that the teachers' union is not decided on one way or the other. So congratulations, at least the teachers' union is thinking right. The draconian rules and restrictions placed on our personal freedoms and liberties are illegal and unconstitutional. All the mandates are recommendations which need to be integrated with personal responsibility. And that's what we heard tonight. We need to take control of our personal responsibility. People are afraid to complain because our elected and appointed officials are busy focusing on the social control of our students. The school committee must rely on input by parents who entrust their children to your care.
Mark, you're at 5 minutes at this point.
Well, that's fine. I negotiated for 8. The sleeping bear has been poked enough to produce a response to the restrictive rules being initiated in our schools. The actions by our elected and appointed leaders cannot be unanswered. We must restore the respect to our students and tax-paying residents and give them the right to choose. They need the freedom to choose not to wear masks if that's what they choose to do. If the administration and the teachers are not vaccinated, then they should be. Can we move on and provide the best possible education to our students without all of these restrictions?
But speaking of moving on, Mark, you're well over. You've almost had twice the 3 minutes that we've allotted everybody. We appreciate your comments.
I just
think
wanted
you've
to
made
make
your point.
sure that you hear this, because this is something I've been hearing from a lot of residents and neighbors.
We appreciate you sharing your
And
thoughts
they
and opinions.
do not like what's going on.
Okay, thank you. Sarah Tugender?
Thank you so much for the opportunity tonight to be able to make our statements.
Thank you, sir.
I have a rising second grader and someone that's in the first ever all-day integrated preschool next year that I'm really excited about. And so when it was just under 8 years ago and I brought my daughter Ella home from the hospital, I remember turning to my husband, we look back. How many parents go, they're letting us just take her home? Like, we didn't even have to pass a test. And all we did was walk around. I remember anyone that held her, it was, are you holding her head up right? Are you doing the right thing? When our pediatrician told us that we had to get vitamin D because she was a breastfed baby, and that was our sole mission for the first 2 weeks, was to give her that vitamin D every single day. Safety is our biggest concern in our household. We even went to a local firefighter and asked him if we were installing our car seats correctly. Paranoid. I watch every little thing that goes into my kids' mouths, what they eat, are they getting enough sunshine, enough exercise, did they take a bath at least once this week, right? I mean, we all have these things that we're thinking of. But that's my choice, and that's what I get to do every single day as I parent my 3 kids, is make those decisions on what goes in their mouth, decisions on their health, and make those decisions on their safety. So I just have 3 points. One, that there was a study that came out of, actually, it was Israel, that showed 47,000 kids who were the ages of 0 to 9 years old, and when they went back to school last fall, the incidences of COVID spread, and them getting COVID, so not just getting it, but spreading COVID, was statistically way less than any other age group that was studied. And there were hundreds of thousands of people that were studied. That was back in September 2020. The second thing is that I just saw a very sad study, as someone who has a 1.5-year-old, that babies born during the pandemic have IQ levels of, I think, 22 points less than other kids that were studied before. And I know that as a result of what we're doing in our schools, for me with my little baby, all the library programs were closed, our stress levels were high, we weren't taking them out, we weren't having that same, interactions and social interactions with them. And the third thing that's really concerning for me, and what I know after spending 15 years working in healthcare, is that they say that the road to good health is paved with good intestines. And if you know anything, that was a joke, you guys can laugh, guys. If you know anything about health, it starts in the mouth and goes all the way through your digestive tract. And having kids, they're actually showing this thing called mask mouth. It's not a clinical diagnosis, it's just what dentists are saying, that it's really changing the kids' whole makeup of their microbiome starting in their mouth. And I don't know the long-term safety effects of that. And that's from long-term mask use, which is just wearing a mask for over 1 hour. And asking my kids to wear a mask all day, I just want to be able to make that safety choice. I choose to pack my kids lunch. I choose for them to not have food dyes. I choose for them to have exercise. I choose, everything that we say to them. And I just want to be able to make this choice when it comes to their safety. And I'm sure like all the other parents, I wish I could just put my kids in a little bubble and walk around like I did when Ella was a newborn and say, are you holding her head up right? Are you doing the right thing? Are you saying nice things to her? But I want to be able to make this choice for my kids' safety for this upcoming school year. Thank you for your time today.
Thank you. All right, next up is Blakely, and the last name begins with a C. Huh?
She was all set.
All set, okay, thank you. Deborah Gesualdo.
Good evening, Chairperson Crane and Danvers School Committee. My name is Deborah Gesualdo, and I thank you so much for taking the time to listen to my comments, as well as everybody else's this evening. I know the work that you're doing is certainly anything but easy, so thank you. I'd first like to start by saying that I actually have 5 pages of links to peer-reviewed studies on how masks aid in the prevention of the spread of COVID-19. But I'm not going to infantilize the group by reading the list out loud, but I'd be happy to send them to anyone who's interested. I'm aware, everyone is, that the Massachusetts Bessie is taking up a request from the Educational Commissioner Riley tomorrow at the Bessie meeting to authorize him to mandate masks for all public school staff and all public school students ages 5 and up until at least October 1. I believe that it is necessary for the Danvers School Committee to still vote on and pass their own mask mandate for the following reasons. The Bessie has a history of failing to take decisive, necessary, and timely action during the course of the COVID-19 pandemic. Guidance coming from the Bessie and out of the DESE building has been piecemeal, late, and incomplete at best, making it impossible for district leaders, educators, and families to plan appropriately. The Danvers School Committee should stand in solidarity with the more than 107 other school committees, many of which are north of Boston, that have passed mask mandates to protect unvaccinated students. Wearing a mask protects people from spreading COVID to these students. We all know that students benefit most from in-person learning. There's no argument about that, as well as the consistency and the steps. This will all aid in the consistency they need and the steps that need to be taken to make sure that our schools can stay open. Safely returning to schools in just a couple of weeks and being able to keep students who are not yet vaccinated and not yet eligible to be vaccinated safe can be done by ensuring universal masking in all of our schools in Danvers. Due to how contagious the Delta variant is, the American Academy of Pediatrics, the Centers for Disease Control and Prevention, doctors from the Harvard Medical School, as well as many other highly qualified professionals currently recommend universal indoor masking for all teachers, school staff, students, and visitors to K-12 schools, regardless of their vaccination status. We know that masking in combination with as many people as possible getting vaccinated, symptom screening, good ventilation, hand washing, and respiratory etiquette, staying home when sick and getting tested, contact tracing, and other prevention measures will help keep COVID from spreading in schools and in turn help keep COVID from spreading in our community. During a global pandemic, we must take all necessary steps to help protect public health, and it is the school district's job to ensure the safety of students during the school day. Masks are one step toward doing that. You can't depend on the Bessie and their vote. It's not a sure thing. The difficult decisions aren't always the popular ones, and they should not be driven by feelings, but by medical and infectious disease experts and what they say. People like the American Academy of Pediatrics, the CDC, and doctors from the Harvard Medical School. Make sure all of the unvaccinated students in our schools and our community as a whole are protected, and pass a universal mask mandate. Thank you again so much for all that you're doing.
Thank you. All right, the last speaker on the list is Karen Ranieri.
Good evening. Thank you for being here with us. I think there is one thing that everyone in the room can agree on, believe it or not, which is we don't want to see one child sick. It's simple enough. I think we all understand it. I don't see any scenario leaving this room and having no mask mandate. I do not have faith in it. I think it will be passed by people who have no medical background, and I think it will be mandated, unfortunately. My request to you is something that someone else touched on up here, which is all or by choice. Do not segregate our children, and it is segregation, by medical status. It is an invasion of privacy. It runs against HIPAA. You will encourage negative peer pressure. You will further divide families and school children, little kids. It is unfair. So, if it is passed, please do not allow unvaccinated kids, quote unquote, to not be masked while you mask everyone else. It is no one's business what my medical history is, nor is it business about my children. In the Lancet on August 10th, there was a study published that said the viral load in vaccinated individuals was 250 plus times higher. And they suggested, and strongly suggested, that vaccinated individuals indoors be masked because they were spreading COVID at a higher rate. The families in Danvers have made their choice. There are no more midnight clinics. There are no more lines. Anyone who wants to be vaccinated has been, except for the children who are not of age yet. Vaccination clinics do not belong in our schools. Testing does not belong in school. It belongs in a medical facility of our choice. I prefer no masks myself, but if and when the mandate is passed, please do not segregate our children and mark them by who has been vaccinated and who has not.
Thank you. Now, as I mentioned earlier, is there anybody else who hasn't had a chance to speak, who after hearing the discussion wishes to speak? Oh, women, okay. Just let us know who you are, thanks.
Hi, I'm Danielle Toomey. I have two daughters that are in the Danvers Public School. I also have been on the front line since the beginning, and I will tell you now that as a frontline worker, we wear an N95, we wear a surgical mask, we wear goggles, a shield, a hairnet, and a gown. These kids at school are not doing that. I also know how to proper don off and don off. which means I know how to put on my equipment and take it off properly and dispose of it. These kids don't. My preschooler, taking her mask off, I go and pick her up. It is covered in saliva and spit and yogurt, you name it. How many times has she touched her shoe and touched her mask, and then she's wearing that thing for 6 hours a day? My 5th grader lost her tooth in school. I kid you not. Blood all over her mask. Okay? We are coming off a summer where kids have been in camps, like Alice said, all summer long. Sports, all summer long. Have we heard of any clusters? Have we? Have we heard of any clusters? Because I haven't. Okay, I just don't think that starting off in September that these kids should be masked. It is a fluid situation. Therefore, we should be able to pivot at any point throughout the school year. If numbers arise, then guess what? We implement some masks and see where it goes from there. I believe in personal choice. Like many parents have said here, it is their children, it is their family, it should be their choice. Thank you for hearing.
Thank you. Anyone else? Yep.
Hey guys, I'm Brendan Malloy, and I have 2 kids in the school system. And again, thank you for allowing us all to speak. It's clear that there's 2 sides to this. You know, there's some people who feel one way, there's some people who feel another way, and that's fine. You know, if you want to have your kids wear a mask, that's great. If you don't, you know, that's your choice and your prerogative. I feel that allowing people to have a choice is a good thing. And maybe, I mean, you guys, if you really value the community and the input here, you know, you should poll us rather than just take some comments from, you know, a few people in the crowd. You know, try to do it in a way. I liked how, you know, the teachers, you guys polled your teachers. You have data. Same with the administrative assistants. You polled. What do you know? Do that to the people in this town, to the community, and let's really find out. Because otherwise, we're gonna try to make these decisions on your own without, you guys represent the community. So I think if you really ask us in a way that, you can poll all these parents who have kids in the school, and let's find out what everyone thinks and make it completely transparent, just so that it's clear as crystal where everyone stands. Because, it was nice to hear that you guys polled the teachers and the administrative assistants also polled. So I think you should do that to the parents. And it should help your decisions, just so you guys aren't making that decision in a bubble, because it's a tough one. Thank you.
Thank you. Anybody else? Okay.
Thank you so much for having us here tonight and having a public forum. It's great to be able to be here to speak to everybody. My name's Jen Cummings. I have a soon-to-be 4th grader. And needless to say, this hasn't been easy for anyone on any front. Whether you're a teacher or a frontline worker, first responder, school committee member, it's not easy. Any decision you make is going to make some people happy and some people not. I just had a couple questions. Do we have a town pediatrician that the board or the Board of Health consults for anything that comes up like this?
Yes, we do.
Is there a reason that during this entire pandemic that we have not once seen the town pediatrician present at one of these meetings?
I don't think there's any particular reason. We've relied on information from the Board of Health, generally speaking, and general scientific information.
That's concerning. We're talking about our children, and we don't even have the town pediatrician here to consult and speak firsthand to the parents about questions that they have. So going forward, I would strongly recommend that the town pediatrician be present at these meetings to provide firsthand knowledge of studies and any other statistical data that has to do with children. That's my first question. We're talking about our children. I would lay down my life for my child. I have 2 children, but my school-age child, we're talking about right now. We're talking about what we feel is right for our children, but have we asked our children what they want? My child today said to me that he wishes this whole stupid COVID thing were over, so he could get back to doing the things he loves to do. That's heartbreaking. The fears that we have as parents, we project to our children. Whatever we are talking about at home, at school, what they see on the TV, is projected onto them. We need to trust that everybody in this room is doing what they feel is best for their child. I don't think anyone in this room would intentionally put somebody else's child at risk. Based on the data from this summer, without masks, it doesn't show that at this moment in time, to echo what somebody else just said, that we need them right now. If things drastically change in the coming weeks, I'm sure, as another parent has said, they've already purchased masks. They're ready. I've already purchased them because I don't want to be left scrambling. If you saw what the masks look like from this past school year, you would be disgusted, and that's after soaking them in OxyClean. I'm prepared for something to change, and I know that this will be fluid, but we have to be able, as I've spoken to the superintendent last year, we have to be able to try, because as another parent said, we're gonna have to learn to live with this. So at points in time, we are going to have to try something different. We were here last year, and here we are again. And we cannot keep doing the same things over and over and over without trying for our children. The last thing I wanted to say is when we're looking at our COVID cases in town, how many nursing homes, congregate care facilities, and other inpatient type facilities do we have here in town? Does anyone know?
Through the chair, we have 7.
So nursing homes, there's actually 8 in town. That doesn't include congregate care facilities, and we also have an addiction treatment center, which has a number of beds in it. When we're talking about putting our children in masks, going hybrid or remote, we have to take that into consideration because our children do not live at a nursing home, nor do they live at a congregate care facility. So those numbers need to be reconsidered when we're looking at making decisions for our children. Thank you for your time.
Thank you.
I would like to make a quick correction.
Of course, sure.
So we don't have a specific town pediatrician, but we do have a Board of Health, and the Board of Health chair is a pediatrician. We also have a pharmacist on the Board of Health. So we don't have a position that's a town pediatrician, but we have a Board of Health with people that are qualified to make decisions on our behalf.
Okay, thank you for the clarification. Anyone else?
Hi, I'm Bob Gamer. Don't wear a mask. Why don't we ask the governor of Texas, Abbott, about wearing a mask? He can't do that because he's in a hospital suffering from COVID. Let's ask the over 500,000 who are now lying in graves because they are dead of COVID. It's more than have died in all of our wars put together. Now I've heard that, getting COVID is like getting the flu. Well, if you want to play Russian roulette with your children, do it. But don't do it in the public schools. You know, we've heard 400 children have died. That may seem like an insignificant figure. But we've got to also think about the long-term effects of having COVID. And every study I've read has shown that wearing masks is a preventative in public schools. And my goodness, if it saves one child, that one child is enough. Thank you.
Thank you, Bob. Anyone else? All right, so it appears that we have exhausted our speakers, so to speak. And so now the question is this. We know that the Board of Education is meeting tomorrow. We know that they're going to take a vote one way or the other on whether or not they will or give the commissioner permission to impose a mandate. We can, at the board's pleasure here, take a vote tonight. We can wait to see what happens tomorrow and schedule a special meeting. The floor is basically open for whatever anyone would like to do.
So I think that I would move to table a vote for a bunch of reasons. Number one, first of all, there was a lot of good information.
Let me see, do we have a second for
sorry.
discussion?
What was
Second.
the motion? Sorry.
Second.
Okay.
Oh, no, he asked what the motion was. What was the motion?
Oh, the
Sorry.
motion was to table.
To table, yes, sorry, Karen.
And I have several reasons for that. Number one, and first, is that there was a lot of very good information that was provided tonight on both sides. And I think it's something to, I don't think it's something to immediately react to. I think it's something that we may want to consider further. And I also like Brendan's idea of, we have a few people here tonight, but I'd like to know what the school public thinks about this. I'd like to know where they are in this. I'd like to know where they are at the elementary level, at the middle school level, and the high school level. Because I came in here basically definitely thinking, why should we have masks at the high school since everybody is vaccinated or should be vaccinated or could be vaccinated? But again, secondly, the Board of Health is going to implement the mandate through October 1st. We know that's going to happen. It is going to happen, and that's going to happen tomorrow. Third, I'm also not comfortable with the fact that, and it wasn't done with any intention or anything that had any other than people trying to do the right thing, but I don't like the fact that on Friday afternoon at 1:30, we said there was not going to be a vote tonight, and then today at 12 or whatever, we said, well, maybe there will be a vote tonight, and I'm concerned about people that got the message on Friday and went to the weekend feeling that there was not going to be a vote, and then today it changed. And again, not that people were just trying to work with what they have, but I don't think that's fair for people to have been told that on Friday, and then we end up voting tonight. So I think that because we have, we're going to have a mandate as of tomorrow, number one. Two, because I would like to get more information on what our school public thinks about this at all the different levels. And three, because I don't think it's fair based upon what we said on Friday versus, changing it today. I think the best idea is to table, and if the Board of Health, if the DESE does not implement the mandate, I don't think there's any way that's not gonna happen, because I think that they already know they're gonna do it. But if they didn't, we can schedule a meeting at any time to vote on this. So that's my position, and that's why I think we should table the vote.
Alice, comments on the motion?
The only reason why I would agree with that would be it would give us time to be more transparent and develop a plan, because I think all the parents in this room still are getting over what happened last year. Someone had brought up the idea that we had no clue what was going on. There was no transparency. So this can provide us with the opportunity to share with the community what our plan would be. Should we start school without masks? Once it gets to this point, we would institute masks. I think what I'm hearing loud and clear from the community is that we need a plan in place where we can sit and be more proactive rather than being reactive from last year. So that's why I would support Arthur in tabling the decision.
Robin?
So, to be candid, originally I was like, we should vote. I think, Arthur, you brought up a really good point, because a lot of people didn't hear or understand till today that we were maybe going to vote, and I think some people couldn't come. I know we might have received emails, et cetera, but again, that was short notice. I guess, we have, it seems like everyone's read different articles, and I think that's great. People obviously came with their research. None of us on this committee are medical professionals, and that's my biggest concern. And I appreciate the information we got from a day, but I do think we need the physicians, the pharmacists, et cetera, to attend these meetings. I think there's a lot of questions that we don't have answered because we don't know. And if we want to be transparent and we want to have the safest plan, it's that, we need that. My concern is that I don't want to vote and look foolish because we don't have the information that we need. With that said, I think it's also really, people kept asking me this, whether or not we wear masks doesn't determine in-person learning. Like, virtual learning is off the table, and I think a lot of people think that, like, oh my goodness, like, I'm going to have to decide if my kid's going to go to school. No, like, that's not an option. I think what we're looking at is how do we keep it the safest that we can, because we don't want outbreaks. And I'm also, I know I brought that up, I'm concerned about the legal aspects. Like, I don't want to get into that. And Keith, I'm sorry, I feel like we always put you on the spot to answer statistics, and I appreciate that, but I think a lot of the times we ask you questions that, like, you don't know because you shouldn't know. And I feel bad for you about that, because you only know as much as you know, but you're a data person, and I love that about you, but you're not a medical professional, and we stump you with questions, and it's not fair to you. So, that's...
Okay, thank you. Jeff?
Yeah, I agree with Arthur's motion to table this for a while, but I will make the comment that as a board, the fact is we are going to have to make some decisions at some points without perfect information. And that's the way it's going to be. And we will make that decision in the optimal time, in the welfare and the benefit of the students when that happens. It could be tomorrow night. It could be a month from now. It could be 2 months from now, depending on what that is. But I will say, I will echo some of the comments of the board. I absolutely appreciate everyone on both sides bringing new information forward. Again, that doesn't mean if we had to vote tonight, we couldn't vote. We would take that responsibility very seriously based on the information we have. But if we do have a couple extra days to sort through some of the information that folks presented tonight, would absolutely want to do that. So appreciate, again, everybody's comments. This is the most I've seen people comment on just about anything. And this is the way it is supposed to be done, so thank you very much.
Can I say something? Because I do think what blew me away was the thoughtfulness behind every single email that I received. I was really blown away that you, as a community, took the time to email us all very thoughtful emails. The conversations that I had with everyone were very thoughtful and I hope respectful. I don't want anyone walking out of this room with any preconceived notions about any of us sitting up here right now. We're asking the questions because we feel like Robin said, we need the information. So that's just what I ask of you guys is kindness. We're here to try to make the best decisions for our children. At the end of the day, that's what we're here to do.
And that's what we got tonight, here. And, you know, we've all seen some of these things happen in different places, and people had different opinions here tonight, but everybody presented well, presented with good information and support, and it makes it hard. But, you know, I thank all of you guys for doing that. I really do appreciate it.
Yeah, I would echo that. I was hoping that, and I was optimistic in that I thought that this would be a fruitful and positive discussions where even people who disagreed, sometimes vociferously, could come together and have a public discussion in a way that was civil and put the best light on thoughtfulness and on the town of Danvers. And I think you've all accomplished that tonight, and I thank you for that. I have no problem tabling it. I think, as Jeff said, however, you know, we're never going to have perfect information. And the truth is that in the end, there's no bright line, right or wrong here. There are only decisions that are going to, you know, make some people less happy than they'll make others. The truth is that for, you know, any studies that you can come up with that show that masks are ineffective, you will find something as recent as Johns Hopkins over the last couple of weeks, a really extensive study that will say that masks are effective. So the truth is what we're trying to do is balance people's individual rights versus the community's right for a safe school environment. And that's a continuum. It's a continuum in terms of almost everything we do. We already have you know, rules in place for when you come to school, what vaccines you have to have. You have to have a physical if you're going to play sports. There are things that are already quote unquote mandates. Most from above where we are, it's something we don't have control over. And in our daily lives, there's a lot of limitation on what might be considered our personal freedom in an effort to create a society that works for everybody, keeps the majority of a community safe. This is a continuum that we are dealing with here as to where does someone's right to decide for their own child and family start to encroach enough on other people's families that you have to say it's okay to limit that right. I don't know where exactly that line is as we sit here today. This has been a thoughtful discussion. But that's what it comes down to. Whether you're on either side of this, it's important to understand, I think, that this is not a you're right and you're wrong. This is more a what's the best thing to do for our students and our community in terms of our safety. I have concerns about the fact that this variant is worse than the first variant. That as you look around the country, it seems to be getting worse. It is involving more children. Those are just the facts. You know, in Danvers, yeah, going from having 50 cases doesn't seem like very much until you realize we started with 1 6 weeks ago. Having said that, the overall numbers, you know, maybe they don't alarm a lot of people. But in any event, I'll support your motion, Arthur, so that we can get some additional time and additional information. Now, from the school committee, are there things that you would like us to ask the superintendent or her team to do in the interim while we get ready to schedule a special meeting?
I'd like to poll the the families. I want to hear what they have to say.
Okay. Then we certainly have time, I think, to do that. It would be, I think, a relatively simple email that could be sent out. Does that work for you folks, Dr. Dan? A
We
quick
could
poll
work-
of the community, sure.
We can work with you as the chair to look at that
Absolutely.
exact
Okay,
language to put
sure,
up.
I can do that. And anything else that you're looking for from the Board of Health, from the superintendent? Since we have Board of Health present, this is a good time if you have questions, information you might be looking for. Let's put it on the table now.
I think definitely whoever the clinical advisor is for the Board of Health to attend.
I'm sorry, say that again?
Whoever the clinical advisor is for the Board of Health to,
So I think we could maybe for the next school committee meeting, whenever that, if it's a special meeting, if it's the next
Yeah.
regularly scheduled meeting in September, and I haven't run this by a day yet, but maybe we look to do a joint meeting with the Board of Health, so that way all their members, and Dr. McLaughlin, who is the chair of the Board of Health, is also the school department's pediatrician, so kind of operates separately, but is the same person, so I could think of that, and then it does, D. Joko is a pharmacist with CVS, so there would be some, I think, medical expertise there, Robin, that we could go through if there's any other specific people you're looking to hear from, if there's others
No,
to
but
invite,
yeah,
but if that,
yes, those
we
people
could go
would
through
be
those, the
excellent.
member, maybe we do a joint meeting, and even if it's a special session before the regular school committee meeting, or we can work through those logistics to have them be present.
yes, thank you.
Statistics on the growth of the other delineations of infections. So my understanding was it was symptomatic infections and then hospitalizations is the standard nomenclature that was used. If that's not correct, if we can get that corrected and get some statistics for the region and for the state as well as any growth projections, growth in the past, because I think that's something that was missing, that would be helpful.
No. Public comments over.
In Danvers, if we can figure out the hospitalizations
Okay.
from Danvers too.
All right, so with that, we have a motion and a second.
Actually,
Oh.
I'm sorry, I thought you were still
Oh, I'm
collecting
sorry,
data. I would like the administration to work on a plan of if it gets to a certain level of cases, then this. I'd like to understand how we'll be proactive in handling masks if we do start the school without masks.
Okay. So if we start without, what's the plan to implement?
Correct.
What's going to be the trigger?
And the opposite, what happens after October 1st?
Okay.
It would also have to include breakthrough cases. You're gonna have to get that data back because the trend was going to
Wow.
50% or more breakthrough cases vaccinated people were testing positive. So if you do not supply that information, you cannot trust the information.
Public comment is concluded. Thank you.
I appreciate you taking into consideration what I said.
Thank you.
But on that, I would like the breakthrough cases too. I
Okay,
think that's
that's
important.
fine.
I was gonna say that.
No, that's fine. No. All right, so we have a motion, we have a second. You all set? Is everybody
All
all
set.
set?
Thank you.
All right. All those in favor of tabling the vote on whether to have a mask mandate, please say aye.
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 All right, so I would expect that we will have a special meeting. May take a little more time now to get the information, but if not by the 30th, it'll be within a few days, I would think of that. So you and I can get together on that date. So I'd like to thank everybody who did speak. I'd like to thank everybody who took the time to come. We're going to take a brief recess and let you ice your name. And we'll be back in a few minutes. Thank you, everybody who took the time to come. of you who stayed, we appreciate it. So let's move on to information from the superintendent. Lisa.
Thank you. We have 3 items this evening. Our first one is to introduce new administrators, and I would like to ask our high school principal, Adam Federico, and our middle school principal, Brendan Norton, to come up to introduce 2 of our new assistant principals. Leaders of our new 6 through 12 team.
Hello, everybody. Thanks for having us tonight.
Thanks for being here and for having patience and waiting.
Our pleasure.
We appreciate it.
From the back row, no, we're really excited at the high school to have really a brand new administrative team. We're pleased to have brought up Julie Scroy from the middle school along with me, who's a career educator at the high school level. And we're also very pleased tonight to introduce you to Ms. Carrie LeBlanc, who has 14 years at Chelsea High School as Dean of Discipline, and is also a resident of the town. So we're very pleased to have Carrie joining us at Danvers High School. So there's Carrie for you.
And I am pleased to announce Daniela Rock as our new assistant principal. She's worked in Danvers Public Schools for 8 years, for 7 years as the health teacher at the Holton Richmond Middle School. And most importantly, we all know how much she really cares about the students of Danvers. So we're really excited to have her as our new AP.
Danielle's right there. Thank you.
Thank you, and welcome. There you go.
I just wanted to say thank you so much. I really appreciate this opportunity. I'm excited to work with the students in the new faculty, as well as Brendan and Patrick and Ellen in the BC team as part of Danvers Public Schools, and developing relationships with the families and with partners. So I'm excited for this school year to get started. Thanks.
Thank you. This is like the free agency system in football, where we get to see all the new players coming in, so this is great.
I'm a little concerned we're bringing in the Chelsea Dean of Discipline.
That, I was going to say, that seems like, yeah. You might have had a few experiences there, yeah. So, but hey, listen, we wish you all the best. It's going to be an interesting year, but sometimes you bring in a whole new team, so to speak, and there's an energy that comes from that. So congratulations and thank you and best of luck. Any other comments from the committee?
My son was able to meet Danielle and Brendan today as part of the HRMS tour, so my compliments to that whole team who put the tours together for our kids. I will use this format to ask what every single parent wants to know right now: when are team assignments going to be released?
Again, I believe they were released today.
Nope.
Wow.
Another party of our group that has since left, we would need to have a conversation.
So I would say soon, yes, they would be coming out this week.
Okay, this week. All right. Anyone else?
Just welcome, and I look forward to working with all the new people and the people who've been here for a while, but in my new capacity, so welcome.
Yeah, and I will echo those sentiments. I mean, it's phenomenal to see so many people brought into positions of leadership that I know are going to have an amazing impact on this team. So thank you all very, very much.
Great, thank you guys. We appreciate it. Welcome everybody, or if you're moving up, good luck moving up.
Thank you.
All right.
Okay, so next we have our strategic plan update, and this will be able to fold right into our goals where there's a vote later in the meeting. So as part of our strategic plan, it's a 5-year plan, and for the opening of schools, we'd like to go over tonight sharing about our summer programming. This is our strategic plan, our 2021 and 2022 goals for this school year, and then move toward a part of our strategic plan that we did not get to before the pandemic, and that's working on defining Portrait of a Graduate for the Danvers community. So at this time, I'm going to turn it to Mary, and she will talk. She was able to facilitate the work with the rec program and our faculty for our summer programming.
Great, thanks. So this summer we had 3 different types of programming. We had an academic enhancement program that worked with Danvers Recreation and worked in the Falcons and Journeys programs. So those programs ran for 6 weeks. We also had a tutoring program, both at the elementary and middle school. Those programs also ran for 6 weeks. And then finally, we applied for and was given a grant for the Math Acceleration Academy. And this was a one-week academy to get kids up and running and get ready for the next school year. And we were charged with targeting students that were most affected by the COVID pandemic. And they really wanted us to keep it to a low ratio to have the most impact with those students. So they asked for a student-to-teacher ratio of 12:1. So we had 31 students participating, 10 in third grade, the rising third graders, 10 in the rising fourth graders, and 11 with the rising eighth graders. So that was done during the last week of the program, the Falcons and Journeys programs, August 9th through the 13th. The Falcons and Journeys went from 4th of July all the way through, week of the 4th of July all the way through August 13th, and we had 290 students participating over the 6 weeks of the program. And then for the Journeys program, which is a smaller grade span, grades 6, 7, and 8, we had 71 students participating over the 6 weeks. And that program really was a focus on project-based learning, and it was quite a successful program for us. And because when we first started out, we only had a few students registered for that when I was with you in June and giving you the numbers. And then once the first 2 weeks went off, a lot of more students participated as each week went on. So it was good. And then just waned a little bit at the end just because of the month of August. So the elementary and middle school tutoring was obviously well received. We had 203 tutoring sessions at the elementary level, which was 100% focused on reading because that was a priority area for us at the elementary level. And then at the middle school level, we were able to do reading, math, and science and help kids catch up from some of the learning loss that they had over the last school year. So.
Okay, thank you, Mary. In looking at this school year, our priorities, and again with our vision statement, it finishes with that our students become productive, responsible, caring citizens of the global community and achieve their definition of success. So as we look at this year and the work that we have been doing last year with our professional development, we want to continue to create a welcoming community for all. That's our students, our families, our faculty members. We want to provide ongoing professional development on diversity, equity, and inclusion for all the adults, so every adult working within our community. We will continue to recruit and retain a diverse and culturally responsive workforce. We're going to conduct ongoing equity audits of policies, procedures, and programs that we began last year. We will include the history of racial oppression in works by authors of color and works from diverse perspectives in our curriculum, and then can communicate about issues of racism and hate as we continue our work as a school community and moving forward as an equity-seeking district. We have engaged students is our priority, and will stay right there in the center of all of our work. We have 3 pillars or 3 areas that will help us to make sure that all of our students are engaged in their learning. So our first one is diversity, equity, and inclusion. These school council goals that you will see and vote on later. Each of these, and I've done an overview here for the community, will focus in on what strategies and the actual action items in timing during the school year. So under this category of diversity, equity, inclusion, we will continue to provide culturally responsive learning opportunities for our students. We want to continue to build sense of belonging for all of our students and all of our faculty and staff and families, and will continue to establish school environments where all feel valued, heard, and supported. And we will continue to implement professional learning so that all adults working with students will strive to become anti-racist educators. The next pillar is coherent curriculum instruction and assessment. And this is really an area that is our foundation. We were seeing that with the work that we had prior to last year with the pandemic, and now we see really, I think, the importance of it also for the assessment. So we will continue to develop high-impact teacher teams to use formative assessment for results, which we've heard the acronym of the FAR cycle, to monitor learning for all of our students. We're going to continue to focus in on elementary reading, and we will implement the multi-tiered system of support. The third pillar is our safe and supportive learning. Here we will continue to support all students in an inclusive, emotionally supportive, and culturally responsive environment. We want to continue to focus in on community, especially as we move through this next part of the pandemic, hopefully moving out of it. We will continue to prioritize student safety and implement practices that build social, emotional capacity within our students, faculty, and staff. And as we finish, we're going to continue to take a look at, again, this is a paragraph from our vision statement, that all students are fully engaged and invested in their learning, and for us to continue to really define that as a community. We will be seeking community members along with our DPS students, faculty, and staff to do visioning, and we will announce that at our September 13th meeting. And then we'll begin to conduct the visioning sessions October through December, and then establish a yearly schedule for a district council to monitor. So for this year, it would most likely be the time we do our mid-year accomplishments and then the end of the year accomplishments. And this would be very similar to school councils, that we really do have a district council that, again, along with surveys and continue, but more of an advisory and an opportunity for community members to work with the faculty and administration to be able to have that ongoing communication. Thank you.
Questions for the superintendent, Arthur?
No, I think I'm all set for now.
Okay. Alice?
I guess I just have one question for the district council. How is that going? Are you going to seek out parents to be on that, or are you going to ask for volunteers?
We will ask for volunteers first, and then I think we'll be looking at different categories. So thinking about hopefully members from school councils or school PACs, or, and again, members of our school community that may not have participated in past committees that we have. So we do want to open it up first, and we hope that we will have a number of volunteers that will come forward to join in on this work together.
And then I had a comment about the summer programming from Mary. I think I knew a couple of families who participated who had very positive feedback on the tutoring specifically. You didn't put up the numbers, but I know you reached out to a lot more families than actually signed up. And I think, that is just something to acknowledge, that the opportunity was there for families to take advantage of it, and unfortunately, the response wasn't as high as we had hoped.
Thank you.
And Robin?
I don't have any questions. Thank you.
Jeff?
Just one on student engagement. One of the parents had something about students, wearing masks, don't wear masks. Students, and a sense of inequality for those. And it got me thinking that, I haven't heard much about, the anti-bullying and some of that lately. So just more of a comment, if there are surveys that we have or information we have on how well students are, in particular in this pandemic time, feeling connected to the community, are they feeling welcome? In that vein, I would like to see that, because I do want to make sure students are, happy. And I think it comes into this portrait of a graduate, right? They're going to come out, they're going to be confident, but we want them to be advocates for this school once they leave. I don't want them to come out saying, I felt marginalized for some reason. So if there is data on that, I'd love to see what students are thinking and feeling on that at some point during the year. I don't know how we work that in, but I think that would be helpful.
Thank you.
Yeah, I have no particular questions. I do think the district council idea is a good one, and I would recommend it for people who are parents and are interested in learning more about the school system, the people in the school system. It's a wonderful chance to take a little deeper dive into what happens, and then share that with members of the community. So I would encourage people to volunteer if they can to participate in that. All right, thank you. And so now facilities update?
Yes.
So we are very excited that the new Smith School continues to come along. We're excited to welcome students next Monday, the 30th, for a first peek. So each grade level has a different time for them to get to come in and see the new building before they enter the first day in September. So that's on the 30th, and then on September 25th, we would like to invite the community as a whole to the ribbon cutting for the building and the formal dedication of the building plaque. That will be at 9 a.m. on a Saturday morning, so we're excited for that. And we're just finishing up some loose ends right now around the playground and site work, and then preparing for the students' return. And then throughout the fall, the building demolition. The building has been demolished, it's down, all that's left is concrete, and the last pieces of that concrete will be removed, and the new parking lot worked on from September, probably into sometime in November. So that work will continue, but we're very excited to welcome the students to the brand new building.
Great. Thank you. Any questions for Keith?
I'll just say that my internet went out, but so I can't read my computer anymore. But I will just say that I went to see the school a week and a half ago. It's unbelievable. It's just like, it's like the best. I want to go back to school.
I've warned Violetta that my office could be there. She might just find me there a lot this year. We also today had our annual safety meeting, so thank you to the Danvers Fire Department, Danvers Police Department, DPW, as well as our team of administrators. We were able to go over all of our yearly trainings, look at what CPR will look like this year for our incident teams that respond, look at the drills, and all of that fun stuff. So it's one of our annual requirements from DESE, and I always say that I'm so thankful to work here in Danvers because, you know, I have the police chief and the fire chief's cell phone number in my phone, so I could call them at any point, but it is nice to formally get us together to go over some of those agenda items each year. And then a thank you to our DPW team, Lee Frockna and his crew, for all of their work this summer. They've been hard at work replacing floors at Riverside, emptying all of the storage containers we had to have during the height of COVID, moving desks, making sure that our buildings are clean and ready to go for the first day for our staff and students. So a big thank you to them for all of their hard work.
All right, thank you, Keith. Let's move on to unfinished business. So first item is the, excuse me, we had considered adopting something similar to the MAS&C anti-racism resolution at our last meeting, which seems like forever ago at this point. And Arthur, I know you had considered a redraft with some changes. You want to talk about your views at this point?
So I'll just say this. I talked to a few people after that. Some of them told me they didn't understand why I wanted to have something that was included everybody. So I don't know what I can do about that, with that view. But in one case, a particular teacher talked to me at length, and it's somebody that I like and respect. And you know, I think in the end, his comment, his idea to me, at least how he and a group of teachers perceived it, is that he really looked at it as a statement dealing with the national issues, the issues that were going on more last year than this year, but that always go on. And I have always been one that I think we should stay in our lane. I don't think our business is to talk about national issues, but it was important to him and the group that he, I think, represented. So that being the case, and because I like him and I've known him for a long time, I'm just going to let it go. And if that's going to make people happy, if that's the perception they have, then we can just go with what you had before.
Okay. So we would need, a lot of ways we can go here. We would need a motion at this point to approve the school committee anti-racism resolution for second reading, which would essentially be adopting it.
It will be adopted?
If we vote yes.
But we can do a motion for discussion, is that?
Well, no.
Okay.
No, well, I mean, yeah, every motion gets discussed.
Right, okay.
But if a motion and a second, now it's on the table, and then at that point, it would be open to motions to amend. Someone could move to amend the proposed resolution to add language or remove language if that was someone's desire, and that motion would have to be seconded, and we would discuss that motion. So, but to begin with, the main motion would relate to a motion to approve the school committee anti-racism resolution as presented.
I will make that motion, Mr. Chairman.
Thank you.
Second.
Second, okay, so we have a motion and a second. And now we have discussion. Arthur, I imagine you're all set.
I'm all set.
Okay. So Alice, you have the floor.
I don't have it in front of me, the previous version, but I will like to go back to what Arthur's point was from our last meeting, in that I do believe it needs to be more inclusive and written in a tone where it includes, thank you, everyone is covered in this.
Okay, any other comments?
No.
Okay, and Robin?
Thank you. Yeah, I think if we had done this, you know, maybe like a year ago, it probably would have looked a little bit differently. You know, my one concern, and Arthur had brought this up before, how many different, you know, resolutions do we have? Do we get into, right, if we, you know, limit it? But Jeff also made the point last time, there's a reason why this was created. Is there anyone else we consulted other than the teachers who maybe like is more of, I don't know, I guess an expert in this field?
I wouldn't say.
Is that, I don't know if that's even the correct term, but.
I wouldn't say an expert, but we did have some input from the inclusion committee here, just informal.
So,
yep, okay.
So I talked to at length with Dee, the chairman of the diversity committee. We had a very good conversation about it. And I don't, I think what they were trying to get to me is that it really wasn't a resolution so much about the Danvers school system as it was about making a statement about what happened in the world. So I don't really want to argue with them on that. If that's what they want, I'm okay with that. It doesn't solve the other problem, which I think we can deal with in a separate issue,
resolution.
Is to have something that talks about what I was trying to get at last time, which is that I would like it, if we're going to have something about anti-discrimination, then I think it should talk about all of the different groups that experience marginalization and that are treated differently sometime, and that they all should be treated appropriately, and that's kind of where I was getting at with that. But the people that I talked to, who wanted to talk to me after I talked at that meeting, were making a point to me about, they looked at it as something bigger. And again, it's a resolution. It's not part of policy, but it was important to them, and I was okay with that, as far as that went. So I kind of put that into a separate category, because that's how they perceived. And it wasn't worth really spending any more time. I mean, I spent quite a bit of time, and it wasn't real. That's what they believed, and that's what I think they strongly believe, and what they wanted the statement to be made. And again, it's not necessarily towards our school system in and of itself. It's towards a bigger societal issue. And so, okay. But we certainly can have, as I was talking about last time, something that would be separate and apart, that would deal with a statement of how we want to treat our students and our staff, which I think we already do to a great extent. But we can certainly put it in writing.
I guess, like, in this, it's written that what Danvers Public Schools will commit to doing. And I do believe it needs to be broadened outside of what is included here. You know, in here, it talks about Black authors, you know, what about Asian authors? So I do think that there is still that opportunity for us to broaden this to include more groups.
One of the things I learned through talking with people about this process is this is and was presented as an anti-racism resolution. And my thought would be, at a later date, we adopt what would be called an anti-discrimination resolution, which would basically cover, you know, all those other marginalized groups, as Arthur talks about. And we don't have to have an individual one for every possible group. but an anti-racism resolution has a particular meaning to a lot of people versus just a raw anti-discrimination resolution. Though I think it's important that we address both. So if it were me, I would like to see us adopt this as written, and then we'll come back with one that is more broad, that makes it clear that we support all groups who are marginalized, and groups that, you know, are especially oriented too. So that's my own thought. And I didn't mean to interrupt, Robin, you're still on the floor.
Well, Arthur answered the question about, you know, the Human Rights and Inclusion Committee, because if he consulted them, right, and if we look at what their mission is, and they're talking to community members and administration and, you know, police, and they're really trying to create an inclusive community, if this is what they feel is the way to go, then I agree. I mean, I do think we should also have another resolution too, but I agree.
Okay. Thank you. Jeff?
Yep, no, I think that's, I stand by what I said last meeting, so I agree. Thanks.
Okay. Is there further discussion? Okay. So all those in favor of adopting the anti-discrimination resolution as written, please say aye.
Aye.
Aye. Any opposed?
Aye.
Okay, so 4-1, we adopt the resolution. And Alice, I will come back with a more broadly written one at a later date, and not too later a date.
No.
All right.
New business.
Next item, new
Yes,
business.
new business. It's our pre-K to 12 school improvement plans for the school year 2021 the school year 2021 to 2022. The superintendent recommends the approval of the proposed 2021-2022 pre-K to 12 school improvement plans for a first reading.
So moved.
Second.
Okay, so we have a motion and a second.
Thank you. And I gave the overview for each of our categories during the strategic plan update, and we have members of our administrative team, our principals, and our curriculum directors who are here for any questions.
Okay. Before we start questions, I do want to thank everybody who worked on these, the school councils and the administration, teachers, anybody who worked on these. It's obviously a tough job to try and look at what's going on in your school and really be forward thinking about it. So
Thank you. And thank you. You did remind me of just one clarification of looking
Sure.
at the timing of this school year, and as we were coming out of last year, through the pandemic, that for some schools, they have met with their school council. For other schools, that will happen before the second reading. So this is an opportunity for this meeting to also get any feedback from our school committee members, to have it be presented, and then we'll be finishing up that process before our September 13th vote for the approval.
Thank you for the clarification, Lisa. So we have motion and a second. From discussion standpoint, why don't we go by level, and we'll start with the high school. Are there any questions on the school improvement plan for the high school? Adam, I think, is here with his team to answer any questions. So are there any questions for Adam on the high school improvement plan?
The only comment I would make on the improvement plan is that the second goal, and I know I said this like 3 years ago, so maybe this is not applicable and someone corrected it, and this is why we saw it, but it's this coherent instruction goal. Like, so, but we already have kind of coherent goals, right? I mean, is there another sort of adjective we would use to really hit home what we're trying to do there? Because I feel like they're pretty understandable and coherent now, but that particular goal is referring to, you know, helping students succeed with a specific purpose, you know, working in STEM, humanities. It's really kind of elevating, isn't it? I mean, is that still the best term that we've got for that?
Great. And I could take that for our administrative team and thinking, because the word comes from our original plan for the 5-year strategic plan, that's from the district level of using the word coherent curriculum instruction and assessment. And I believe that we're really looking at, we're not 100% there in what we're looking at with the multiple tiers of student support, the formative assessment, is that we are still in that process. It's not happening with that fidelity in all of our classrooms, and we're still learning some of those pieces that we really had. Mary always gives the example of beginning of March, we were at a planning session in professional development and had plans, and then the pandemic really hit our educational system. So I think that's why, Mr. K, we still have the word coherent, and I appreciate the feedback, and we can take that back to the administrative team in between the two readings.
Yeah, I mean, I love what's underneath it. It absolutely hits them. I'm just like, there's going to literally only read the first 3 bullets, and they're like, okay, what is your main goal, right? It's a great school environment, supportive learning, and coherent instruction. People are going to be like, this is going way beyond being coherent. This is really trying to take it to the next level. So, and maybe because it is the 5-year plan and we can't adjust it now, I get it. So if I ask this again next year, you can just tell me to stop. but I get it. So that was the main point. Everything else looks great. Thanks.
Thank you.
I have one question, which is on the first bullet under goal number 2, hire, deploy instructional technicians to support intervention work in STEM, humanities, SEL. I presume those are the persons we're going to hire based on the federal funding?
Yes.
Who will be coming in, new teachers and/or students who are interested in, we'll bring those folks in to give them a chance to help out. Do you want to speak to that a little bit, Adam? Or?
Yeah, with those positions, we wanted to target educators that are maybe new to the profession and back into the profession. We really want to use those roles to support our current teaching staff, so we can be deployed in classrooms. It could be to do small group instruction in identified areas. It could be to take over larger instruction so that then the classroom teacher can work with specific students. They also can do some tutoring, focused tutoring with either individuals or small groups. So we wanted to sort of create a position that was bringing in a higher level of skill than maybe a teacher aide position, but that was going to work kind of in between our teaching staff and the students. So we tried to design it that way, and we identified kind of 3 broad areas, obviously with STEM, humanities, and then SEL. So we're finishing up that hiring now. We were sort of strategic and not in waiting to hire, because in the hiring cycle, this is a good time to maybe grab some candidates that didn't land a teaching position, but they can bring a lot of good to our school. So that's kind of why we landed the timeline of this. It's actually closer now that we're kind of finishing this up.
Good, excellent. Anything else for Adam while he's up?
Okay, Adam, I'm gonna put you on the spot for a second.
Oh, good.
Okay, the last goal, so for goals 1 and 2, I see that the resources are filled out, but I don't see anything under goal 3. So I'm just wondering how the plan to measure the progress of it.
So I think, broadly, this goal traditionally, if you kind of go way back, this used to be sort of the anti-bullying goal. And over time, I think that idea of a safe and supportive learning environment has expanded quite a bit. So I think this year, if you notice, this goal and goal number 1 both start with the same strategy, which is implementing our new community meeting block. And so that part really gets at, I think, sort of more those kind of safety things, whether it's bullying, environment of the school. The rest of this goal is really focusing more on what I would call the supportive learning environment part of that title. So now we're talking about safety in the curriculum, access to the curriculum. So what we tried to do with this goal was really think about the full range of learners in the high school and how are we going to craft an environment that is sort of safe and effective and supportive for them. So in terms of data, just to get to your question, a lot of these things, and I filled in some of them actually, there's a later copy that it should be filled in now, so hopefully you'll get that.
Oh, okay, okay.
A lot of the resources are measured with our partnerships with outside groups. So for example, our early college program, that's a partnership with North Shore Community College that we'll be able to get data in terms of course credits that our kids earn this year. Something like, the Pathways program or even the Project Lead the Way program, we'll be able to look at how many kids took those courses, what kinds of courses, what career fields did they connect to. So I think we'll be able to collect data on student outcomes from this year. And then if you circle back to the beginning, our community meeting block. Because it's got a very structured built-in time to our day, part of that work will be getting feedback from kids about the outcomes of the new community meeting block. That could be a Google form, that could be more anecdotal, that could be, you know, meeting with kids and hearing what they have to say about it. It's a product of student feedback and faculty feedback, how we landed here, and then that'll continue along. So I think, you know, as we go back through these plans throughout the year, I think we'll be able to come back to you and say, here are some tangible pieces of data or ways that we're seeing things are going well or not well, and here's how we're going to adjust it. So I'll make sure you get the most updated one with more resources listed, and that should, I think that should address that as well.
Yeah, and I think it's great that, you know, you mentioned different types of data, because it's qualitative and quantitative, and we have to, you know, can always be numbers, right? Like, it's also qualitative.
I think this goal especially, we're looking for a balance. We want to get some data, you know, especially maybe around, I think what Mr. K, you were speaking to earlier, how kids are feeling about being in the school, maybe, and there are, both the middle school and high school will be doing the youth risk behavior survey this year, so that'll give us some good quantitative data, and then I think we can sort of put alongside that more anecdotal, more qualitative data where we hear from kids more directly. We can use technology to maybe collect that, but it'll be more of that qualitative side, sort of the story of the kids and what they're seeing, what they're experiencing.
Awesome, thank you.
You're welcome.
Okay. Thanks, Adam. I think we're all set with Adam? Are we all set? All right. Time to put our middle school principal on the spot here. Any questions for our middle school principal on the school improvement plan? And I should say principal and staff. So. I think they've decided to go easy on you the first
No, I'm laughing
Here you
because,
go.
Brendan, as I read these, I keep thinking of SMART goals, which I love as an educator. Because I'm a dork like that, but that just made me happy.
All right, let's move on to the elementary school. And again, the best way is if you have a particular question about a particular school, let's have that person come up. You know, any points of any on any of the elementary schools?
I just have a clarifying question, maybe it changed. I remember at one point it was like all the elementary schools shared one common goal, and then they got to then individualize the other goals. Is that still the case, like based on what the students need?
Yes.
All right, thank you.
Are we doing elementary now? Is that the?
Yes, yes.
So the only comment I would make, and I do this almost every year, is the reading level, since it's so important. And we do have these statistics, right? So middle of the year, right before the pandemic, this one is Riverside, but it's pretty much the same for all schools, right? Reading level, grades 1 to 5 were reading at or above grade level, basically 71%. K through 4, by the end of the year, the latest pandemic numbers looks like it's 59.77, almost 60%. So, you know, I don't, maybe it's in here. I don't know that, I guess we must have a goal. Do we have a goal for catching up? And I know we had some good, you know, uptake in the summer reading program, so hopefully that helps. But was there a goal to get back to the 71% for most of the schools? Yes, it's only been 6 years. Yeah.
So yes, you are correct that pre-pandemic in January, right before we did middle of year data collection, we were at 70% at or above benchmark. And this goal is based on a broader goal within the strategic plan that by June 2023, 90% of our second graders would be reading at or above grade level. So always we've had this trajectory from the 5-year strategic plan where we were going to increase every single year. So we had an original trajectory, and then the pandemic took a little back to our original trajectory, but what that means is this year, our percentage growth needs to be much higher than it would have had to be pre-pandemic. But as you, and I'm looking back on goal 2, I realized we didn't even put this in. So last year, our reading teachers were all classroom teachers. This year, we'll go back to our 6 reading teachers, and using the ESSER funds, we also hired 2 additional reading teachers. So we're going from last year having no reading teachers to this year, going into this year, we have a very, very strong team. They're excited to get going. Every school will have at least 1.5 reading teachers, which is an increase from pre-pandemic. So I think we're really excited. We've had a lot of professional development on reading. We're doing a lot going into the next week, PDs? Yes, it's all it's all happening. So we're doing a lot of focus on small group work, conferring, tightening up. Reading is definitely a huge focus at the elementary. Okay, I'm going on and on. Jeff, your question was, are we going back to our trajectory? Yes, we are going back to our trajectory. Is that going to take more work this year than previously planned? Yes. But we have resources in place and we're focused on it, and that is our goal.
That is fantastic. That energy is going to carry us through a lot this year. So thank you all. And it's funny because you look at the numbers and you're like, okay, we're going to go for this and we're on a trajectory and whatever. But I mean, you got to get beneath the numbers, and it is people, you know, that are going to make this work, right? This is our team that is going to make this work. And so thank you all for putting all of this in here. That, you know, there's a lot of stuff that you're going to do that is not listed in here that we know, but we kind of just see the sort of end result and say, how is this going to work? So thank you for the enthusiasm and for having the planning and making it work. So that's amazing. Thanks.
Anyone else, comments or questions on the elementary school learning?
Yeah, so on the last one, the safe and supportive learning environments, it said the implementation strategy guidance for SEL work with students will be provided during PD time. So just wondering if there's something we need to do, or if you need more from us as far as like PD, like, because I know we have the SEL frameworks, right? But like, you know, this is new to us. We're implementing this and to make it effective. So I guess I'm just, you know, I guess saying if there's something that, I guess what is the PD, I guess, was my first question. Like, is it from teachers? Is it from an outside source? Okay. So the SEL part is also a big part of, obviously, at the elementary level. As I like to say when teachers interview, what are you looking for? I want the kids to be happy and I want them to be reading. So we are fully focused on that as well. Our framework for SEL we're going to unveil at the mandatory professional development. And we've had, Mary has led a social emotional learning district-wide group. And the elementary part of that has been hard at work for the last few years doing a lot of adult SEL. And we're moving towards shifting that to what does our work look like with the students. We're not prepared. We don't want to rush to implementing a specific curriculum and we have a lot of resources at our disposal. So our plan for this school year is to provide teachers with a framework, with examples. Here's an SEL, here's a standard, here's some texts that are in all the libraries that you can use, here's some questions you can ask your kids, here's some open circle lessons. We used to do a ton of open circles. We put together kind of what's the right word? A smorgasbord or like a compilation of resources that will explain to teachers this is our focus going into the school year. It's about building relationships. That's our first core competency we're working on. These are all the resources that we have. Here's the pre-K lessons. Here's the K1. Here's the 1-2. Here's the 3-4. And then the SEL committee will continue throughout the year to build those examples and compile those resources for teachers to use. That's where we are right now. Mary can talk more about the long-term plan, but that's where we're headed into this school year. So it's not an official curriculum program. It's a teacher-developed resources put together for teachers to utilize during their SEL time. Okay, thank you. I guess my question was, I feel like we always think of like, we say like, what do the teachers need support? But like, what does the admin need support to be able to make this successful too, right? So like, as long as you feel like you have the resources to do that, I have faith in you. But I guess I'm saying if you need additional things to please let us know so this can be successful.
super good right now. We have
Okay.
some awesome people doing this work
Awesome.
who are wicked smart and very competent. And they are pulling books and resources and linking them and putting them all together for teachers so they have an easy thing to utilize with their students. So thank you for asking. I think we're okay right now.
Good. Any other questions for our elementary business? No. All right, thank you all. So why don't we take a vote? We have a motion and a second to approve the school improvement plans for a first reading. All those in favor, please say aye.
Aye.
Opposed? None carries. Thank you, Lisa.
Thank
And,
you. Thank you to the team.
the next time we get together, school will have started. And so I'm sure the committee wants to wish you all the best for a terrific school year, people in new positions, trying things new, lots of enthusiasm. We hope this year is certainly easier than last year, and we thank you for all you do. Now, if you want to leave, you can. If not, you can sit for the rest of the meeting.
Head up. Okay. Thank you. Okay. And
All right,
Mr.
Lisa.
Chairman, we missed
Not you, Mary Beth.
letter B on unfinished.
Well, wait, they might be just.
I just need to go back to that one right here.
I thought we were just,
We did this one here, the resolution, and then I missed the handbooks for a second.
oh, I'm sorry, sure.
That's okay.
All right, we have one more item
you
of
have any
unfinished business.
Yes, so we do have one more item under unfinished business, then we'll go back to new business. The superintendent recommends the approval of the proposed 2021-2022 pre-K to 12 student parent handbooks for a second reading adoption.
So moved.
Second.
All right, we have a motion and a second. Is there any discussion? Hearing none. All those in favor, please say aye.
Aye.
Opposed? None. Carries. Under new business, our next step is the annual vote of student activity accounts.
Thank you. The superintendent recommends the approval of the 2021-2022 list of accounts and maximum balances.
So moved.
Second.
These are effectively rotating accounts, similar to what the town
Similar to a revolving account, yes.
Yep. Any questions on this one?
I had a question.
Feel free.
There's, like, some fees in, well, not fees, but expenses for, like, the Cody outdoor education. Are we expecting that to happen?
So they were able to come to us last year, so we did it through Nature's Classroom at the middle school.
Okay.
So we'll look to do some version
Something
of
similar.
it next year. It might not look like the traditional overnight trip that was done in the past, but
Okay.
there'll be some sort of version of it.
Any other questions? All right, all those in favor, please say aye.
Aye.
Opposed? None. Carries. All right, moving on to order of business. First item is the consent agenda. I don't think that the minutes can be included in that, so Arthur, if you would make the motion in terms of the minutes.
Okay, Mr. Chairman, I would move to approve the June 14th and June 25th, 2021 minutes, and to approve and release the
Looks like
Oh,
all of
school
the
year.
school year.
Oh,
Right.
okay, the entire school year 2020, 2021 executive session minutes.
Is there a second?
Second.
Is there a discussion? No discussion. All those in favor, please say aye.
Aye.
And that carries. The remainder of the consent agenda, is there a motion to adopt the, all of the particular items on the consent agenda?
Move to adopt the consent agenda items.
Second.
All right, we have a motion and a second. Is there any discussion on any item? Hearing none. All those in favor, please say aye.
Aye.
Opposed? None. Carries. And Lisa, communications?
Thank you. Communications, we put this on our every agenda is our North Shore Education Consortium, and our first official meeting will be the second Wednesday in September.
All right. Legislation, I have nothing to report this month. I'm going to try and see if either Representative Kearns or Senator Joan Lovely can come to either the September or October meeting and give us a direct update, and we can ask questions, which is always good. Subcommittee liaison updates. So we're heading into the year. I think, I don't know if any subcommittees have done any particular work over the summer, but as we were listening to the school improvement plans, I wanted to turn back very briefly to the curriculum and assessment and equity subcommittees. Curriculum and assessment is Alice and Robin, and equity is Alice and Jeff. So I basically typed out some general items for you guys to consider, but as I'm sitting here listening to the school improvement plan, think of the curriculum and assessment as where you go to answer that question about the coherent curriculum. And think of the safe and the equity as going to look at the safe and supportive learning environment by meeting with people, finding out how it's going in individual schools. Curriculum would be mostly talk with Mary, but coordinate to talk with others who you think might be important to help. This is one of those ways we can give life to those school improvement plans and be able to evaluate them. So, and I'm certainly, we can talk about it. Those are just my ideas. If you have others, it's your subcommittee. Other than that, anything particular on DEEP or any of the other subcommittees?
DEEP hasn't met, obviously, and I was going to ask Mary Beth when she was here when the first meeting is, but she's not here, so.
She still hasn't missed a meeting.
No, she hasn't.
Speaking, yeah. Okay. Let's see.
It looks like it's September 15th.
Okay.
Okay. Danvers Cares?
I don't think, has a new meeting been scheduled? And also, I did receive the note on Whitney. Does that mean she's not leading Danvers Cares now because she has a full-time position, or she's not doing double duty?
She's not doing double duty to do that. So we did announce that Whitney McNally was the executive director, but we did have a resignation in high school guidance, and Adam has hired her to be a high school guidance counselor. So we are making that transition at this time and working with a team and looking at what the structure will be. But we always want to reiterate the piece of our commitment to Danvers Cares as a partnership and how valuable the work that everyone that comes in the feedback and the collaboration as a community partnership. So we will continue the pieces.
Yes, and the youth risk behavior survey that Adam mentioned as well is typically managed by Danvers Cares, so that is something we'll keep track of.
Yes.
All right. Anything on CPAC?
Not at this moment, no.
Okay.
Our next piece would be setting up the meeting with our new Director of Student Services, Lynn O'Neill, with our CPAC co-chairs.
All right.
And then we'll have their meetings for this coming fall to begin with.
Excellent. And we have, I'm sure, nothing on policy since the last meeting. Human rights and inclusion, we're in the planning stages for the upcoming year. And also scholarship, the students who received our scholarships were at the last meeting. What a great bunch. Terrific students. And we're just going to cooperate any way we can with the MLK planning for the beginning of the year.
Yes, we'll set up that planning meeting.
Okay. And I believe that's it. Our next meeting is September 13th, 2021. Arthur, is there a motion you have in mind?
I would make a motion to adjourn.
Is there a second?
Second.
Thank you all for your patience tonight. All those in favor, please say aye.
Aye.
Aye.